Mayor Sohi is not on the meet.
Good morning. I believe we have quorum, so I'm going to call this meeting to order. And start by acknowledging that this is the place we're gathered today is the traditional land of Treaty 6 territory. And we thank the diverse Indigenous peoples whose ancestors' footsteps have marked this territory for centuries, including the Cree, Dene, Saulteaux, Dakota Sioux, and Blackfoot peoples. We also acknowledge this as the Métis homeland and the home of the largest concentration of the Inuit south of the 60th parallel. This has long been a welcoming place for all peoples who come from around the world to share Edmonton as a home. Together we call upon all of our collective honor traditions and spirits to work in building a great city today and for future generations. Start with a roll call of committee. Councillor Jans.
Good morning.
Councillor Wright.
Good morning.
Councillor Tang.
Good morning.
And Mayor Sohi has just joined us.
I am here.
Thank you. I think we also have a few other councillors with us. Councillor Salvador.
Good morning.
Councillor Rutherford.
Good morning.
Councillor Principe.
Good morning.
And I think that's it for the moment. I'll take a motion to adopt the agenda. I don't think we have any changes to the agenda.
So moved.
Thank you, Councillor Wright. Please vote.
Yes.
In favor.
Thank you. The vote's just coming now.
Yes, for me.
Thank you. We have all the votes.
Please display the vote. That is carried. Just a reminder that it's a lot easier for the clerks to keep notes of minutes and things like that if everyone uses eScribe.
Yeah. Just signing it.
I'll take a motion for approval of the minutes, the March 16th and March 21st meetings.
So moved.
Thank you, Councillor Wright. Not seeing any exceptions or changes to those minutes. Please vote on adoption of those minutes.
Yes.
Thank you, Mayor Sohi.
I'm also yes. I'm locked out of eScribe.
Thank you, Councillor Jans. We have all the votes.
Please display the vote. That is carried. Protocol items, I'm not aware of any. So we'll move now to selection of items for debate. Waiting for people to click in. Councillor Tang.
Thank you, Mr. Chair. I will go with 7.1. I believe it's time specific. 6.1 and 6.3. I'll leave my colleague for 6.2.
Thank you, Councillor Wright.
Yes, 6.2, please.
Don't see any other selections. And maybe just on item 4.1, Madam Clerk, that note that this report is to be dealt with at a different meeting, that is just to indicate a previous redirection.
Correct. That report was due to this meeting originally, but it was rerouted at the February 14th Community and Public Services Committee, so it's just a note so that the public is aware.
Very good. Thank you. Seeing no other selections then, would someone care to move the balance, the 4 item and the 5 items?
So moved.
I had Mayor Sohi first. Please vote.
Also in favor, still locked out.
Thank you, Councillor Jans. Just waiting on Mayor Sohi's vote.
Yes.
Thank you. We have 5 votes.
Please display the vote. That is carried. Madam Clerk, would you please summarize what we have approved so far today?
Thank you, Mr. Chair. This morning, Community and Public Services Committee has passed the recommendations of the following reports without debate. Item 5.1, Festivals, Support and Growth, with a revised due date of June 13th, 2022. Item 5.2, Indigenous-led Shelters, Housing and Programming, revised due date June 27, 2022. Item 5.3, Administration of the Sport component of the Community Investment Operating Grant Program, with a revised due date of May 30th, 2022. Item 5.4, City-owned recreation spaces for youth-free admission drop-in activities, with a revised due date of May 30th, 2022. Item 5.5, Licenses for rental providers and public access to information, will be going up to Council to be rerouted to the April 26, 2022 Urban Planning Committee meeting. And item 5.6, Overnight Paddlers Parking Pass, will be has a revised due date of to be determined.
Great, thank you very much. Request to speak. I think I'll just move this myself. I think I got the most recent list here. So I will move that Community and Public Services Committee hear from the following speakers in panels where appropriate. On item 6.1, Problem Properties, Christy Morin from Arts on the Ave, Karen Gingras from Edmonton Community Development Company, Anna Bubel from Edmonton Community Development Company, Sasha Grasso, Eric Estrada from the Alberta Avenue Community League, Cora Shaw, Karina Hurtado, Doug Paquette, and Maggie Glasgow. On item 6.2, Support for Women's Shelters, Leslie Allen, Alberta Council of Women's Shelters, Karen Kingdom, Alberta Council of Women's Shelters, Shakia Khan, Nisa Holmes, Jan Reimer, Alberta Council of Women's Shelters, Patricia Vargas, Catholic Social Services, Lorena Shelter, LaSalle Shelter, and Drexel Place, Sue Languedoc from the Community Initiatives Against Family Violence, and Cindy Furlong from Community Initiatives Against Family Violence. On 7.1, Control Drug and Substances Act, Section 56, exemptions. This was previously approved at the March 21st meeting. Petra Schultz from Mom Stop the Harm, Elaine Hishka from remotely, Alyssa Miller, Boots on Ground Harm Reduction Society, Ewan Thompson, Each and Every, Business for Harm Reduction, and Darren McGowan from Arcadia Brewing Company. We've also had additional speakers registered for this item. Janetta Savalaggio from Opioid Poisoning Committee, Kelsey Speed, and Neil Lamontagne. Please vote on hearing from those speakers on those items.
Just, I guess, a question there.
Yep. Councillor Tang?
I'm just asking on behalf of Councillor Rutherford, if the resident with the last name, I think Grouse, to be the first to speak. Pardon me, Councillor Rutherford, for which item?
We can arrange the speaker items when we get to those items.
Yeah,
That's,
okay.
that's fine. They're not,
21.
we're not cast in stone what the order is, so that's fine. We'll just come to it when we come to it.
Great, thank you.
Okay, so if we can please vote on hearing from those speakers.
We have 5 votes.
Please display the vote. That is carried. Request for specific time on the agenda. There's no requests, but we did approve the agenda with item 7.1 as first item of business. So we will then move to item 7.1. I'm assuming there's an administration presentation. Am I assuming correctly? Anyone? 7.1, admin?
So Councillor Cartmel, I don't actually think there's a presentation. There's a report in your package. This was in response to an inquiry from Councillor Jans. So I leave it to you to how you want to manage the item, but we do have a number of people online prepared to answer questions or address parts of the report if you prefer.
Okay, thank you, Ms. Plouffe. That's fine. Then we'll move directly to speakers. And so before we get going then, I'm going to do my speaker introduction here. So for those that are attending the meeting to speak today, for each item, administration may provide opening remarks or a presentation. Members of the public who have registered to speak will then be invited to make their presentations. Speakers will be heard in panels. Each speaker will have 5 minutes to present their remarks. The clerk will run the official timer here in council chamber. For those in chamber today, the timer lights on the podiums will be green for the first 4 minutes, yellow for the final minute, and red when the final 5 minutes are up. If you are participating virtually, you may wish to use the timer of your own. When everyone in the panel has had a chance to present, member of council may ask questions of you or other panel members. For this reason, you may wish to remain in the meeting until all questions have been asked of your panel. If you are participating virtually, please remember to mute your microphone when you are not speaking. If you're experiencing any technical difficulties, please reach out to the Office of the City Clerk using the contact information provided in your confirmation of registration or at city.clerk@edmonton.ca. If you're here with us in person, the clerk will guide you to your seat when it is your turn to speak. As Edmonton transitions from provincial mask mandates and the city temporary mask bylaw, we ask visitors in council chamber to be kind and respectful to each other. You can wear a mask to protect yourself and those around you, and please respect people's personal decisions around wearing masks. In the event of an emergency, please follow the clerk's directions to evacuate. City staff will direct you to your muster point. From there, we'll go to our panel, and we will start with Petra Schultz from Mom Stop the Harm, who is here remotely, followed by Elaine Hishka, who will be joining us remotely, and Alyssa Miller, who will be joining us remotely. Petra Schultz, are you with us?
Yes, I am.
Great, thank you. You have 5 minutes. Please go ahead.
Councillor Cartmel, can I ask a process question, if you don't mind? I do have a motion related to this. You want me to table that now? That
No, we hear from
wait till
speakers
we
first,
okay, got it.
and then we'll
Okay,
have
got
questions of admin.
Got it. Good.
And I know that Councillor Tang selected this item, but I think because you have a motion, Mayor Sohi, I'll come to you first when we get to administration.
Okay.
You can table that motion, and that might
Got it.
expedite our discussion today.
Okay, that's what I was thinking of, how we get through the agenda today. Good, thank you.
Thank you.
Yeah.
Sorry, Ms. Schultz, please proceed. Thank you very much for joining us today.
Thank you for the opportunity to present to you today. I'm the co-founder of Mom Stop the Harm, a network of Canadian families impacted by substance use-related harms and death. We have over 3,500 members in Canada, over 700 in Alberta, and 175 in Edmonton alone. Most of our families are mourning a loved one who died from drug poisoning, while other member families desperately fight to keep a loved one alive or support their recovery in these difficult times. For me, both apply. My oldest child lives in BC, where they thankfully have access to a program providing regulated substances. My youngest son, Danny, died in 2014, just a few blocks from City Hall, of fentanyl poisoning long before it made the news. He was in recovery when he relapsed and took one more pill he bought as street oxy that, unbeknownst to him, was fentanyl. We did not know he had relapsed. We did not know that he was at risk. Like Danny, people who use drugs hide their use because of stigma and fear of the consequences of disclosure. We need to know when our loved ones are using so we can keep them safe. We need them to feel safe to reach out for help, but fear and stigma prevent that. Nothing stigmatizes like a criminal record. It impacts where people can live, what they can study, where they can work, travel, and who they might enter in a relationship with. No wonder people try everything in their power to hide their use, often with tragic consequences. We hear from organizations like the Alberta Chiefs of Police that people are already not arrested for possession, so there is no need to decriminalize. Not arresting is not the same as not criminalizing. We leave the decision to arrest or not in the hands of individual officers who, when we allow for that level of discretion, Indigenous people and people of color are disproportionately arrested, charged, and incarcerated. Officers also confiscate drugs, which means that the person needs to go out and replace what they had, risking harm to themselves and the community. Not arresting, whatever that means, is not the answer. We also hear that decriminalization is going to fail. To that, I say what we are doing right now is an abysmal failure, unless you measure success by the number of funerals families have to arrange. Last year, a staggering 1,758 Albertans died from drug poisoning, with Edmonton's numbers amongst the highest in the province. We also hear that the supports and services are not ready for decriminalization. What supporting people who are unhoused has taught us is that housing first policies are most effective. What we are asking for is a health and well-being first policy when it comes to substance use. There are those who say decriminalization is not a silver bullet. I agree, it's not a silver bullet, but it's one of the important tools we need to address this crisis. If done right, decriminalization will allow us to shift resources from the criminal justice system to the health and social service system to help rather than harm. We need a public health approach to substance use that includes the acknowledgement that most people who use do not do so in a disordered or problematic way, but are just as affected by the criminalization of substance use and the toxic drug supply as people who are deemed to live with addiction. For too long, we have inflicted harsher and harsher penalties, and what we have to show for is more dead, more people in jail, more harm to communities. Many of our members have a loved one charged in jail on probation. Others had loved ones die in the criminal justice system or just after release. This system bankrupts and destroys family and does nothing to help the people we love. If what we do is not working, we must try another way. And that's why I, on behalf of families I represent, urge this committee to act on the report before you and recommend to City Council to proceed with the application for a Section 56.1 exemption from the Controlled Drugs and Substances Act. Criminalization of substance use has harmed individuals, families, and communities far too long and has to end because the lives of the people we love depend on it. Thank you very much.
Thank you, Ms. Schultz. Just before we go to Ms. Hishka, I neglected to mention that item 6.1 is time specific for 1:30. So if anybody is hanging around for the problem properties discussion, we're going to start that time specific at 1:30. I apologize for not mentioning that earlier. Ms. Hishka, are you with us?
Yes,
Great, thank you. You have 5 minutes. Please proceed.
thank you. Thank you very much for the opportunity to join the committee today to speak to this very important issue. My name is Elaine Heshka, and I am a PhD researcher at Canada Research Chair in Health Systems Innovation at the University of Alberta School of Public Health. I've been researching this topic for the past 15 years and currently serve as the co-chair of Health Canada's expert advisory group on safer supply of pharmaceutical alternatives to illegal street drugs. Between 2017 and 2019, I was also appointed as the co-chair of Alberta's Opioid Emergency Response Commission. So as noted in the report, and obviously will be discussed today, Edmonton has been particularly hard hit by the drug poisoning crisis over the past several years, but perhaps no more so, or the most in the last year and a bit. We know that in 2021, 666 people died in Edmonton of drug poisoning, and that's out of 1,758 in all of Alberta. I appreciate that Council has taken an interest in this topic as the situation is only worsening. And I think without direct intervention and more action, we can expect to see the numbers in Edmonton and across the province increase in 2022. So I'm here to voice my support for Council's interest in pursuing a Section 56 application for decriminalization. And I applaud your interest in this, in following other Canadian municipalities and the province of British Columbia down this path. So there's, from a public health perspective, there's actually an abundance of evidence that shows criminalizing people for minor drug offenses is counterproductive. It does not deter substance use. but it does increase the harms of substance use. And this happens in many ways. First, by encouraging people to hide their use or use alone. Second, by encouraging people to delay or put off seeking help if they have an addiction or substance use disorder, or if they're experiencing other negative health concerns. And this delaying comes from fear of stigma, being treated poorly in the healthcare system, from fear of criminalization itself, and also from fear of potentially experiencing other sanctions, such as those from child welfare or from employers. Saddling people with criminal records for using drugs limits their life chances in terms of their employment and their travel opportunities, and it increases the risk of economic marginalization and engagement in other criminal activity. A criminal record can also make recovery from a substance use disorder more challenging. Beyond the harms of criminalization, we also know that the law is not evenly applied across the population, and that racialized people and Indigenous people are much more likely to be charged with drug offenses than other people in Canada. This is a fundamental inequality in law that can be remedied in part through the decriminalization of minor drug possession and other offenses. And when we talk about drug decriminalization as well, it's important to be clear what we mean. There is a distinction between drug decriminalization and what we would call depenalization. So decriminalization is not simply replacing criminal sanctions with administrative sanctions, such as fines or court summons. This would be depenalization. Depenalization, or applying administrative sanctions instead of criminal sanctions to drug possession or other offenses, carries the risk of actually increasing contact for people who use drugs with police and the criminal legal system through a net widening effect. As administrative sanctions are easier to apply than criminal ones. And so when it's actually easier to lay administrative sanctions, this can actually increase the number of people that are subject to those sanctions because the administrative burden has been reduced. Unfortunately, though, administrative sanctions can have similar negative outcomes as criminal sanctions, such as loss of income, socioeconomic marginalization, and stigma. Decriminalization in this context and across the country means the removal of sanctions for personal possession or other minor drug offenses. And it's important too that we consider extending the decriminalization application to not only include minor possession, but also minor trafficking or minor sharing, because we know that many people who use drugs that are socioeconomically marginalized participate in this activity for subsistence or to assist their friends or family who are in withdrawal. So I look forward to the conversation today. Unfortunately, I regret my one hard commitment during the week is my teaching, and I have to leave briefly at 10 o'clock to assist some of my students with office hours, but I'll be returning at 10:15, and I'm happy to speak further with council and answer questions. Thank you.
Thank you. Next is Alyssa Miller. Ms. Miller, are you there?
I believe Alyssa has withdrawn.
Oh. Okay, then we would go next to Ewan Thompson.
Hello, I'm here.
Thank you. We'll have you followed by Darren McGowan and Janetta Savalaggio in that order. So go ahead, Mr. Thompson. You have 5 minutes. Thank you.
Thanks so much. So my name's Ewan Thompson. I'm the Executive Director at Each and Every Businesses for Harm Reduction, and I'm speaking here from Mohkinstsis Treaty 7 lands. And I acknowledge the disparity of drug prohibition's impact on Indigenous and racialized people in Alberta and across Canada. I hold a PhD from microbiology at the University of Alberta, and I've personally trained over 100 people on overdose response in Edmonton alone. So despite my current residence down here in Calgary, my loyalty to Edmonton runs deep. And that love affair really has only deepened over the last few years as I've gotten involved in harm reduction and drug policy and gotten to know the Boyle-McCullough neighborhood in particular. I will warn that given the gentrification that's ongoing in that area, things are going to get worse there, and they are happening. That is happening right now. We're seeing some of the highest rates of drug poisoning in Boyle-McCullough out of anywhere in Canada, and that includes downtown Eastside Vancouver. So it's very much worth taking some measures right now to try and get ahead of the tragedy that's already unfolding. So the aims of Each and Every Businesses for Harm Reduction are primarily centered on safer communities, healthier communities, and a supported workforce. So we take our cues from people who use drugs. We're really trying to pay attention to the needs of the community and respond to them, because if we're not working for them, then who exactly are we working for? And so some of the things that I've heard in response to the ideas around decriminalization and some of the steps that other jurisdictions have taken on this has been that number one, driving this whole movement really has been that people will act in a way that's consistent with how they're treated. So if we're continually criminalizing people for their drug use, then they'll start to think of themselves as criminals, and they'll adopt different practices in response to that. That's just a fact, and I've definitely experienced that in my own life with the way I've been treated in different circumstances. Number two, the fear of police and the medical system is present in equal measure for a lot of people, and it really manifests itself through trauma and aversion. It really ultimately means that there are invisible barriers to accessing health services for people that most of us can't see. And when we look at number three, the Vancouver decriminalization process in particular, it really did tokenize the involvement of people who use drugs. So at the last minute, the city ended up bowing to police aims to set very low carry thresholds. And that means that people are not able to carry as much drug volume as they need to get on with their day and really enjoy the benefits of decriminalization. So I really implore you to avoid that kind of situation if the time comes here. So one of the people that I really lean on for information from the community of people who use drugs is a guy named Garth Mullins. You may have heard of him. He runs the Crackdown podcast out in Vancouver. And this is a statement straight from him, so I'll just read it. What he says is that what I noticed is that some decriminalization schemes wind up being all about what drug users should do, what treatment they should get, what pathway to programs should be open, what information they should have accessible, even self-stigma they should shed. But really, decriminalization is about what the police should do. More specifically, it's about what police should stop doing. I also reached out to Michelle Robinson, who hosts a Native Calgarian podcast down here. And she told me, she gave me another statement, so I'll read that as well. She says, Canada has continued to criminalize Indigenous peoples with the War on Drugs campaign by not having culturally appropriate services, full truth or reconciliation with the lack of action on the calls to action, without implementing the calls to justice of the National Inquiry into Missing and Murdered Indigenous Women, Girls, and Two-Spirit. We will continue to see an overrepresentation of Indigenous peoples in the legal system. This is also an issue of poverty-related crime and the Indian Act imposed. Propaganda and societal anti-Indigenous bias continues to keep Indigenous peoples on the bottom of the socioeconomic ladder. So our position as each and every Businesses for Harm Reduction, we're rolling out this substance use policy for workplaces. And the aim of that really is to destigmatize, decriminalize, and demystify substance use around the workplace. Number one, we recognize that the harms of drug use are largely associated with criminalization and how it relates to social inequity. Number two, that autonomy and the human rights of people who use drugs have absolutely been left behind, and this has never been more visible than the parallel responses to the COVID crisis and the drug poisoning crisis. Number three, mandatory treatment is not supported by any research. It's equally effective to no treatment at all. Number four, no research supports a deterrence effect for drug use prior to commencing work. So abstinence and fitness for work are not at all the same thing. How decriminalization is done really matters the most. So we endorse the Decrim Done Right platform. That's a national one developed in 2021. We think Edmonton should too. Ultimately, policing should reflect the broader population and the workforce, and these are quickly shifting away from prohibitionist mentality. Next week, hundreds of businesses are going to adopt our policies. So we think that there's going to come a day where the current model is ridiculed for pushing forced treatment and abstinence testing. We don't need those as part of our decriminalization platform. And I'll just finish by saying that a year ago, many of us here today spoke to Edmonton City Council on Scott McKean's motion, which also called for exploring decriminalization. Please do not let another year pass where 666 Edmontonians could die. Please take tangible steps. Thank you very much.
Thank you. Next we'll have Darren McGowan, followed by Janetta Savalaggio and Kelsey Speed. Mr. McGowan.
Hello, thanks for letting me speak today here. My name is Darren McGowan. I'm the owner of Arcadia Brewing Co. I work alongside Ewan at Each and Every. I help them out. I've closed ties with the Boyle Street, and we've hosted events in our brewery, which is more or less a supervised consumption site, with other organizations in the past few months. We have spoken about the drug poisoning crisis. We've spoke about supervised consumption sites. And we've just had open, frank conversations. And what I've really gathered from hosting these events is the biggest problem we seem to have is the stigma of a lot of people who are experiencing drug poison and overdoses is they are seen as criminals, and they don't seem to want to find help in our community. So decriminalization was one thing we just spoke about to end that stigma. And we're looking at the numbers here recently. I mean, like 23 overdoses a day they're averaging is just, as a business owner, we don't feel safe in our community for our community members. They might not be customers of ours, but they are community members. And as a business, I would really like to see some steps being made. And yeah, like Ewan said, we cannot be waiting another year for something to be done. We need changes now. And I can't speak for other breweries or bars, but as a business owner of Arcadia Brewing Co., I support decriminalization. So I don't have too much to add today. I'm feeling a little under the weather of medication, so I have to cut myself short here today. But thank you.
Thank you for your comments today. Next, we'll have Janetta Savalaggio, followed by Kelsey Speed and Neil Lamontan. Ms. Savalaggio?
Thank you very much for having me. My name is Janetta Savalaggio. I'm an academic family physician. I'm an associate professor with the Department of Family Medicine at the University of Alberta, and I'm also the co-chair of the Edmonton Zone Medical Staff Association's Opioid Poisoning Committee. The reason our committee formed 8 months ago was ultimately we were fed up as medical professionals. We've seen the system strain on the health system. We have seen our patients die, our colleagues in my case die, because I do community engaged research, and it is heartbreaking. We all know someone who has died or experienced long-term sequelae from the drug poisoning crisis. And our ultimately goal in creating policy recommendations is to contribute to the conversation to try to prevent drug poisoning deaths and related harms. We are in support of public investment in all evidence-based addiction and mental health interventions, but we chose to focus on policy gaps for our recommendations, and we recognize that all levels of government have a role to play, and so we really appreciate the opportunity to speak with the city today. The recommendations were developed using scientific literature, available epidemiology, and iterative input from people who use drugs, their family and friends, and other expert partners. We are a multidisciplinary group of physicians. We work both in the community and in the hospitals, and we have no professional or personal material interest in these recommendations and no conflicts to declare. These recommendations, basically, the poisoning response more broadly require a comprehensive response. As somebody mentioned earlier, really, we're not talking about a silver bullet, no, because it all has to be delivered in a package. The focus today is on decriminalization, but we do say that it is part of a broader conversation about a variety of supports to help people who use drugs. So specific to decriminalization, I won't dive into what it means or those sorts of things, because I think that other speakers have spoken to that and you have reports and so on at hand. I wanted to focus on the health and social impacts of criminalization versus no. What we do know is that criminalization of substance use limits the availability of evidence-based treatments in the community and also in jail settings, carceral settings. Evidence shows a heightened risk of poisoning death following release from prison as well, where individuals face compulsory abstinence and involuntary detoxification. And we know that in the 2 weeks following release from prison, that's the highest risk period, where people experience a 12 times higher than average mortality rate. So people are leaving that jail system with that immediate risk of death. However, we also know that incarceration and subsequent criminal records lead to social stigma and exclusion, which should matter as co-citizens of this city. We may see barriers to seeking help. I certainly see that now. I think about what was it like prior to cannabis law reform and what it's like now, and people aren't scared to tell me about the cannabis use. Imagine if people weren't scared to tell me as a physician about their drug use and wanted to have an open and honest conversation. That would be a game changer. But people continue at this time to see barriers to seeking help. It results in the use of drugs in secret and in circumstances and environments that increase their overall risk of morbidity and mortality. It leads to economic penalization. Imagine not being able to find gainful employment or housing opportunities once you have a record. It does lead to inequitable access to healthcare due to fear of criminal reprisal, because certainly if we're criminalizing the public spaces, we're criminalizing healthcare spaces as well. So ultimately, we are calling for decriminalization of possession for personal use as a way to reduce that overall harm to our community and to people who use drugs and their families. We know that decriminalization in other jurisdictions has not been associated with escalation in drug use or drug-related problems. And so we just ask that the city consider implementing a decriminalization zone while other levels of government continue to have a conversation about broader decriminalization in support of that. Thank you very much for your time.
Thank you. We'll go next to Kelsey Speed.
Thank you for the opportunity to speak in support of this important issue today. My name is Kelsey, and I am a researcher in health equity and social justice, and my work aims to improve the health and well-being of people who use drugs. There is strong evidence in the literature that criminalizing drug possession and use results in significant harm to people who use drugs and to communities more broadly, which is consistent with what I have seen and heard through my own research. People who use drugs experience disproportionately higher levels of discrimination, violence, and stigma in their everyday lives. For example, negative experiences with healthcare professionals often lead to delayed healthcare access, meaning that people wait until they are sicker before asking for help. This leads to unnecessary suffering and more expensive treatment. Additionally, criminalization also makes it more likely that people who use drugs will use their drugs alone or hide their use from those around them, which increases their risk of drug poisoning and of having no one around to intervene if a drug poisoning does occur. Further exacerbating the harms of criminalization is the fact that criminalization is applied inconsistently, and certain subpopulations of people who use drugs are more likely to experience these negative outcomes than others. This means that people who use drugs and are homeless or unstably housed, are Indigenous, or are at other structurally vulnerable locations experience higher rates of the negative outcomes associated with criminalization. For those who use drugs who have a criminal record, they're limited from accessing many housing and employment opportunities, which contributes to further and sustained exclusion and economic marginalization. Removing the criminalization framework and chance of obtaining a criminal record from drug possession and use will increase opportunities for people who use drugs to participate in society by removing the criminal record barrier present in many housing and employment contexts. We are in the midst of devastating loss of life, and complicity in maintaining the status quo is unacceptable. The fact that the harms experienced by people who use drugs stem from criminalization rather than drug use itself helps us target our interventions to the policies that create these risky environments instead of incorrectly targeting the individuals who use drugs. We know the next steps of what we need to do, and we need you to take bold action to improve the health and well-being of our community immediately. I urge you to move forward with requesting an exemption under the Controlled Drugs and Substances Act to decriminalize minor drug offenses in Edmonton. Thank you.
Thank you. We'll now move to Neil Lamontagne. I'm afraid you're on mute, sir, if you would like to start again.
It looks like Neil is unmuted, however, we cannot hear him. It might be sufficient to leave the meet and rejoin. Sometimes it seems to reset.
Yeah, we still can't hear you. We'll stand by while you... Nope. Maybe leave and rejoin.
Looks like we still can't hear you, Neil. Just wanted to test again to see if you're speaking. There might be a setting on your computer depending on what microphone you're using to adjust there. If you'd like, we can get someone from the clerk's office to reach out to help you to troubleshoot a little bit.
There's also an option to join by phone, yes?
There should be a phone number that was provided in your registration, and if you use a cell phone or landline to call into that number, we should be able to hear you that way.
Yeah, we still...
It looks like someone
Hello?
There we go.
Okay. Okay, please go ahead, Mr. Lamontagne. You've got 5 minutes.
Apologies, Neil. You need to stay on the line with your phone number. You need to have the phone on and use it as if you're phoning a person. So it seems that your number ending in 68 disappeared from the meet, so it looks like you may have hung up. If you don't mind phoning that number again.
We'll give it 1 more minute here, and then we'll have to move on. Okay, well, I'll tell you what. Why don't we start populating a list of councillors that have questions for our first speakers. When Mr. Lamontagne gets his tech in order, we'll go back to him. So please click on. And I'll start with Councillor Tang. She exempted this item, so we'll start there for speakers. Councillor Tang?
Sure. Thank you, Mr. Chair. I guess I want to start with Dr. Savalaggio. Can you have mentioned in your statement that research from other jurisdictions show that after decriminalization, it has not seen significantly increase other impact, and I'm wondering if you can share more about that. Are these jurisdictions that have already implemented decriminalization? I'm assuming from elsewhere in the world. If you can just speak more to that.
Yes, correct. And to be honest with you, yeah, I don't know where we're at with specific municipal decrim zones within our country, and I'm not certainly a legal expert. Our read of the available published data from other countries that have explored decriminalization is that overall it has not increased, social disorder type calls, drug related problems, drug use in general. If anything, it just allows people to access the supports that they need. So yeah, that's, I mean, certainly we're looking at places such as, many people have heard about the Portugal model in Spain and so on.
Yeah, Portugal definitely does come up and faces some criticism in their approaches as well. And I think a lot of times, a big critique of this is we can solve the problem by, and this is something I've certainly heard a lot as well from the other side, is that you can give people the opportunity to use more drugs. Can you just talk a little bit about to debunk that myth a little bit?
Sorry, I missed that last question, the last part of your question.
It's just that I think there's a lot of perhaps criticism from the other side, just around, well, decriminalization, you're giving people the opportunity to do more drugs. You can solve a drug crisis through that. Can you, I suppose, debunk that myth if it is indeed so?
Yeah, I mean, I think it really, the secret sauce is in doing it right. And that talking about, I know, you and talked about decrim done right earlier, and really you have to implement it correctly. And so just the whole notion of does it lead? We're not talking the Wild West here. We are talking about an environment where there are still controls. We're not talking about a completely unregulated environment, and we certainly know that in completely unregulated environments, you're going to run into problems. But I think, as we've seen with alcohol prohibition, I mean, complete prohibition is not the way to go, and it increases harm as well. But complete unregulation of alcohol was not the way either. So it's similar to that. I mean, I think the other thing that we can say from what we've seen in other models of decrim is that there's been a fall in drug-related mortality, and no increased rate of youth use, like increased adolescent drug use, and then there's been a reduced incidence of things like HIV infections and so on. So there are all those ancillary benefits, and again, if it's properly regulated and managed, we don't see a lot of the worries that people are having about completely unfettered drug use.
Yeah, and I don't know if Dr. Heshka is back online, but I think that's kind of what she was referring to in terms of decriminalization and depenalization. Dr. Heshka, are you back online?
I am.
Okay.
Well,
I guess I'm just wondering if you can paint a bit of a picture of, we're not, like Dr. Savalaggio mentioned, it's not the Wild Wild West, but when done right, what was some of those, still very much regulated environment look like? If you can just paint a picture.
Yeah, I think so. I'd back it up and just speak to this question as to whether the criminal law influences substance use rates one way or the other. And what we know, if you look across internationally, across different jurisdictions, because different countries take different approaches to all kinds of illegal substances, not including cannabis and other drugs. And there has been a lot of research that has compared cross-jurisdictionally, whether rates in the countries with more liberal approaches are higher than rates in countries with more conservative approaches. And when you look at a variety of changes that we've seen over the past several decades to cannabis, for example, we know very clearly that there is no correlation between the severity of the penalties for possession and the rates of cannabis use in a given jurisdiction. So in some cases, the severity is quite high, rates of use are quite high. In other cases, the penalties are very minor, but use is quite low. And then you see the opposite of those patterns. So really, it's important to recognize that if we want to deter substance use, it's not going to be through criminal law. And to deter some substance use, or for the criminal law to be effective, it would have to be swift and certainly applied. And we know that that's just not the case with drug use, which is a crime that some have called like a victimless crime, in the sense that there's rarely people that report substance use. It's just something that is very difficult to police. So the criminal law is not going to deter substance use. It's also not going to encourage substance use. And that's why we argue that we need to decriminalize minor drug offenses, because we know that while it doesn't really deter substance use, it has a significant impact on harm.
Thank you so much.
Yeah, sorry.
And I really appreciate
Sorry, Councilor Kang.
No worries. I'm sure others will pick it up. Thank you very much.
Thank you. Do we have Mr. Lamontagne's connection?
Hello, can you hear me?
Yes, we can. Please go ahead. You have 5 minutes. Thank you.
Thank you. Sorry about that. That was a little odd. Anyways, my name is Neil Lamontagne. I'm speaking in support of this initiative. I'm not a public health expert. I'm a city planner. I'm a faculty member at the University of Alberta Planning School. And as a planner, I'm very concerned with the health and well-being of communities. As part of this, I've become very concerned and supportive of practices of care and harm reduction. To put it bluntly, people are dying because we are pushing them to the margins. It's a complex issue, and certainly the process of pursuing the exemption, the 56-1 exemption, is itself complex. But I believe it is prudent and an opportunity for Edmonton and our city to lead with compassion, follow the evidence, and help keep all of our community members safe. Thank you so much. Please support this motion and initiative.
Okay, thank you. We'll go back to questions from council. Mayor Sohi, you're next.
Thank you to everyone for your participation today and your work and advocacy. And my heart goes to Ms. Schultz for your loss and to 666 other families who have lost loved ones. So this is an issue that we need to find solutions to. So my question is to Elaine Hishka about decriminalization, which we should absolutely explore. But this is one tool among many, many other things that needs to be done in order to tackle this poisoning crisis. So I just want to get your perspective, the holistic approach to tackling this.
Thank you for that question, Mayor Sohi, and I appreciated it particularly because 5 minutes goes very quickly and I wasn't able to touch on some of those other important topics. I think that we need to be very clear that decriminalization is imperative, but it is not a panacea. We can't expect that decriminalization alone will solve the drug poisoning crisis our city is facing, though it will help many people to be less reticent to seek help. And it will also reduce some of the negative harms of criminalization,
So
particularly on vulnerable populations.
what are some of the other components?
Other strategies that I think are really key to advance in our context are expansion of supervised consumption services. I think it's very difficult to look at the data from the last year and deny that the closure of the Boyle Street supervised consumption service, which was the busiest in Edmonton, has not had an impact. Certainly, if you look at a quarterly level, we know that the rates of visits to supervised consumption services in our city decreased significantly after Boyle Street closed and did not recover to the end of 2021. So there are less people accessing these services in our city. Beyond that, I think we need to look at trying new initiatives like Safe Supply, which is has been advanced by Health Canada since 2019 as a potential solution for people who are dependent on illegal street drugs to take them out of the illegal market and provide them access to regulated drugs as alternatives. Beyond that, I think housing is such a critical issue. We know that people who are homeless and unstably housed are much more likely or at higher risk of drug poisoning. And I'd also say too, the city's efforts to work towards reconciliation, I think, are very important. Indigenous people in Edmonton and Alberta are far more likely to die of drug poisoning than other people in our city. And that represents the legacy of colonization and racism that we continue to see today. And so the city taking efforts to improve health equity for that population, I think, is very important and will also have an impact on reducing drug poisoning risk.
Yeah, no, thank you for sharing that, because sometimes when these kind of initiatives are seen in isolation from a comprehensive strategy, they do leave impression in people's mind that is the only solution or this is the only solution that City Council is exploring. I want to turn to from Mr. Thompson from each and every. Just want to understand the impact on businesses, because there's not only a human crisis, the impact on families, but there's huge impact on businesses when these kind of social issues go untreated. In the case of vandalism or disorder, because we are seeing that in the downtown, we are seeing that in Chinatown and other business districts. I want to get your perspective on that.
Thanks so much, Mayor. That's a really wonderful question, and I'm glad you asked it, because what I've had, through all these conversations I've had with businesses, hundreds and hundreds of conversations now, with people, in downtowns, in rural areas, and so on. What we keep hearing from people is that they want to see solutions where people are welcomed back into the community in some way. They feel that the biggest issue right now for people's perceptions around safety in our downtown cores and so on is actually just that there's this population of people that have just been pushed to the margins to such an extent that that they can't be interacted with in a way by the general public that makes everybody feel comfortable and on the same footing. And so I think ending the criminalization of all people who use drugs will take a really massive step in terms of welcoming people back into society when they've been pushed out for so long. So it's just one step, and I'd encourage this strongly in order to make business, storefronts and so on, safer places for everyone.
Yeah, thank you so much, everyone, for joining us today. That's it. Thank you, Councillor Cardinal.
Thank you, Mayor Sohi. Councillor Wright.
Thank you very much. I'm just wondering, Dr. Savalaggio, you indicated that all levels of government have a role to play, and Dr. Hishka did mention a few things. So besides what the province and the federal government are doing, what else can we do besides the housing? Any other suggestions?
Well, I mean, certainly housing is one piece. I think just the whole strategy around involving citizens who are traditionally pushed to the margins, this has been discussed by co-speakers here, involving them in co-designing these solutions and getting them involved in the planning. For example, what we've seen in some jurisdictions is when people who use drugs aren't involved in determining what those amounts for personal possession are, that things don't get implemented as smoothly as we would like, because all of a sudden you end up criminalizing on other grounds. So it's important for us as a city to adopt very much a co-design model and a public involvement model in any decriminalization or other supports that the city deems necessary. I think the other thing too is to ensure that there's around the existing supervised consumption sites that people aren't targeted going in and out of these facilities, because that may be also a deterrent to using the facilities. So it's something else to consider, as well as just making sure that that the location around supports is safe for people to go in and out as they need. Those are some examples that come to mind, but definitely that piece around meaningful partnership and engagement with people who are directly affected by this.
And I'm just also wondering if you can maybe tell me what drives people towards use of opioids.
Wow, so it's huge. And I think I've bought into the notion of complexity science, and it's a very, very complex space. And I don't think there's a single root cause that leads to drug use. It's very, very complex. There is a common narrative out there, certainly, that I can certainly touch on around people thinking that, oh, somebody got hooked on opioids from a prescription, and nothing could be further from the truth. We certainly know now that the overwhelming majority of drug poisoning deaths are not related to a prescription. So that may have had a role to play 20 years ago. The epidemiology is very different now. So how do people get there? It's very complex. Sometimes it's related to mental health. Sometimes it's related to trauma. Sometimes it's related to prescription, yes, but not always. So it's very, very complex how people get there.
Okay. And it really impacts a wide cross section of people in Edmonton or
absolutely. We have been very clear. There's no neighborhood that is not affected. Unfortunately, there are some groups that are more affected than others, disproportionately so.
All right, thank you very much. And just my last question, I think, goes to either Ms. Schultz or Dr. Hishka. You both talked about charges and that being laid I'm just wondering, is there any data to show how many people have been charged with possession?
I'm not sure if Elaine has exact data, but there is national data available, and the HIV legal network is very good in keeping that kind of data, and I could connect City Council with that organization. It really is a strong element of race in there when it comes to laying charges. There's data that supports that if you are an Indigenous person or a person of color, is more likely to be charged with possession. And also of class, of course, that a white middle class person is less likely to be charged. That's why we oppose the idea of discretion, just saying, oh, we are not arresting, because it's not truthful, and it's certainly applied in a discriminatory kind of way. I don't know if Elaine has any exact stats. I don't have any at my fingertips right now, but thank you for that question, Counselor.
Yeah, I can add a little context to that. So in Canada, we know that the vast majority of drug charges that are applied are for the crime of minor drug possession. So like more than 50%. And I actually would cite Mayor Sohi had a blog on the weekend that cites the Edmonton Police Commission as saying that 2.5% of criminal violations in Edmonton are related to drugs, and 83% of those violations are for possession. So I do believe that if we are to decriminalize and take the legal system out of, the issue of possession of drugs or minor drug offenses, we have the potential to save substantial police resources that could then be applied to other areas of citizen concern, like violent crime, property crime, and things like that. And so I think also it's possible that some of those resources could be redirected to health and social programs to support people who are struggling with substance use.
Thank you. Thank you.
Thank you.
Councillor Principe.
Thank you, Mr. Chair. My question is for Dr. Savalaggio. You had mentioned that, drug decriminalization does not result in drug use increase, correct?
Yeah, I mean, in a properly regulated environment, so where there are certain where it's not completely unregulated, yeah, we haven't seen any increase in other jurisdictions.
Okay, so my concern, and the concern that has been brought to me from constituents, is that will there be an increase in public usage though? Will we see it out in the public more?
I don't think there's really any evidence for that. Now, I am not a criminology specialist, but I have yet to see anything that suggests that there is an increase in public use, public disorder, or anything arising from this. If anything, people are encouraged to use in safer spaces, and certainly public spaces are more of an unsafe environment, so alleyways and so on. So people are no longer driven to use in public washrooms and so on because they don't have to hide their use in that way. Are we going to have people using drugs in a public square? I think that's very, very unlikely to happen. But
well,
we do. Sorry, go ahead.
I respectfully disagree, because I actually witness it myself often, seeing drug use in the open. And again, that has been brought forward to me from constituents. They're concerned. A mother with her children in the LRT station seeing people openly use drugs. The concern is that would that be increasing? And an example is I have personally witnessed, and I'm imagining many people have as well, people smoking marijuana while driving since it's been legalized.
So, I mean, I respect that there may be stories, single, one-off stories and so on, and witnessed observations and so on. But if you look at just the overall statistics and the numbers, that doesn't really bear out. That's my understanding.
Okay, well, that's good to know. Thank you. That was my only question. Thank you.
Thank you, Councillor Principe. So that concludes questions to our speakers. We certainly thank all of you for participating today, and particularly since this item was bumped from a couple of weeks ago. So thank you all for rearranging your schedules and making your presentations. We'll now move to questions from administration. I'm going to go to Mayor Sohi first and ask that he put his motion on the floor, and then we can cover both questions to Mayor Sohi and to administration at once.
Yeah. Thank you, Mr. Chair. Administration does have a copy from the when we had this at the previous meeting scheduled. So if you don't mind, please putting it up on the screen. In the meantime, I can start reading it. That Community and Public Services Committee recommended to City Council, number 1, that administration work, I'll just go here, that administration work collaboratively with stakeholders, including but not limited to Alberta Health Services, Alberta Health, Edmonton Police Services, public health and medical experts, people with lived experience, family and patient advocates, and Indigenous peoples to develop recommendations to reduce drug poisoning injuries and deaths in Edmonton, including providing recommendations to pursue a Section 56.1 exemption to the Controlled Drugs and Substances Act to decriminalize simple personal possession, excluding trafficking to illicit substances in Edmonton. And second part is that administration develop an intergovernmental advocacy strategy to reduce drug poisoning injury and deaths in Edmonton, including decriminalization of simple personal possession, safe supply, safe consumption size, treatment, and supportive housing. And will be due back first quarter 2023 to Community Services Committee.
Second.
No second required at committee, but thank you for your enthusiasm. Mayor Sohi, did you want to introduce?
Yeah, I will briefly introduce this. You know, we've been facing this crisis and the impact of this crisis not only on individuals and families, but in communities as well as our businesses. And I think not properly tackling this issue is holding us back in many ways. And I believe that if we have a comprehensive plan in place, including the decriminalization of simple possession, it will give us additional tool along with many other tools that are necessary. We have been advocating to the province on safe supply, on harm reduction, on supportive housing, on treatment. So once we have more information on decriminalization, we can add that to our advocacy to the federal government as well. So this is about looking for all the possible solutions to deal with poisoning crisis. And I believe that if we get more information, and also we need to involve all the organizations, because Edmonton City Administration doesn't have the expertise in this area. So we need to make sure that we are involving the Alberta Health Services. And also we're hearing concerns from Edmonton Police Service about they have some divergent views, so we need to make sure that they're involved in it, as well as the people who have lived experience and particularly people from Indigenous communities. So I'll stop it here, Mr. Chair, and if there are any questions, I can answer those. I think that's kind of a brief introduction.
Thank you, Mayor Sohi, and I will note that this is a recommendation to City Council, so this would appear on the next City Council agenda, but I really encourage my colleagues to, let's fully discuss this here and tease this out so that we're not duplicating the conversation at Council. Next would be Councillor Jant.
Thank you. I think it's a really strong motion, and I'd certainly be proposed to speak in favor of it. I was wondering if the mayor could share a little bit more about the second portion about the intergovernmental advocacy strategy, because I think we have seen a lot of openness from the federal government in terms of wanting to see any options and creative solutions across Canada. So how could Edmonton's leadership here help create a model that could be scaled up and out? And I was wondering if the mayor could share a little bit more of his thinking there.
Yeah, so what I have in mind in this is that intergovernmental advocacy, there are other municipalities that are pursuing this as well. Vancouver is looking at it, Toronto is looking at province of British Columbia is looking at it. I think there's an opportunity for us to align our efforts with their efforts and maybe build a kind of a joint advocacy with them in relations to the Pacific exemptions. But I also have in mind that this intergovernmental advocacy needs to be broader than just exemptions, because we need to talk about harm reduction, we need to talk about safe supply, we need to talk about interventions, treatment, and housing. So we need to have a kind of comprehensive plan so that we are tackling this issue in a very coordinated, comprehensive way.
I'm really thankful to hear that. I mean, two things surprised me when I put forward this inquiry. Number one, how much overwhelming positive support I received, that I thought it would be a lot more controversial than it was. And really, so many people have been reaching out with heart-wrenching stories about losing loved ones. I really feel the narrative has changed since even 5 years ago. The second thing that surprised me is a little bit of the whataboutism from opponents. And one of the things I frequently heard was, well, decriminalization is not a magic wand. And I thought, yes, of course not. It's only one small measure in this whole toolbox that we must explore. So I'm very happy to hear that you're including all of those other options and different approaches there too. So yeah, I guess in the interest of time, I don't really have anything to add aside from gratitude to the speakers and everybody who shared their stories and their lived experiences. And I'm personally ready to vote and support this.
Thank you, Councillor Jans. Councillor Stevenson.
Thank you very much, and I agree that I think the clear need for this is very evident. So not too many questions. Just wanted to touch base, Mr. Mayor, if you can speak to, or if it's for administration, on the timing. So I see that this would be due back in the first quarter of 2023. Would we anticipate that at that point, at least a provisional submission would be ready to be submitted? I'm just really mindful of the comment about the urgency and not needing to wait another year. So just want to clarify that what will come back in first quarter of 2023 won't be the recommendation that we move forward with the exemption, that we're actually going to start that work now.
That's to administration or to? Yeah, I would assume that, because but I think one thing that report identified that the application is very, very complicated and comprehensive, and they require a lot of community engagement as well as working with the social sector and the police services in order for the application to be successful. I understand the urgency. I think we need to make sure our application is strong, that there's a strong business case in this case that we can develop. But I would assume that work will start happening.
Okay.
Right away.
Yeah, and I think the reason I'm asking that is just the wording, that including providing recommendations to pursue. So maybe if someone from administration could clarify that what will come back in Q1 2023 will not be the recommendation to pursue, but rather an application that has incorporated the recommendations of the various stakeholders to inform the application that will be made.
Jennifer Flaman, Deputy City Manager for Community Services. Yes, that is the intention, but there is a recognition that this will take time and resources, and we will do our best, and we'll keep Council advised of our progress.
Great, thank you so much. I'm really pleased to see this moving forward, and definitely see that it will be a complex process, but I'm very pleased that this work will get underway. Thank you.
Thank you, Councillor Stevenson. Councillor Tang.
Thank you, Mr. Chair, and thank you, Mr. Mayor, for putting this forward. I really appreciate the opportunity to have provided some input previously, and indeed, this is very complex. I guess so I have some questions for administration. The motion that Mr. Thompson referred to earlier, that prompted Councillor McKean for a letter, I'm wondering what happened to that. Do we have any follow-on or any responses back? I'm not sure who specifically was leading that effort at the time.
Jennifer Flaman here. I'm uncertain. We'd have to maybe look with the clerk, and we can get back to you.
And I see Ms. Oke, if you want to respond.
Yes, good morning, Council. I can mention that the letter was sent. I believe that's the motion to send the letter to the federal government. And that letter was sent, I think it was summer of last year. But I cannot speak to the response back since the letter was sent. So we will have to circle back with Council on that.
Yeah, I mean, I think that's one thing that we have to kind of build off of, but recognizing letter writing alone isn't enough. I'm also curious about, in the report, it outlines the role of Toronto Police, Toronto Public Health, which is, a very different jurisdictional structure than in Alberta. I'm curious to know in the Alberta and Edmonton context, what kind of tables do we have around opioid poisoning and the drug crisis? Do we have the city, Alberta Health Services, and the police service at the table in very substantial roles, whether it's task force or committees or whatever?
Thanks for the question, Councillor Tang. There are a number of existing tables that are currently being used to advise the city on its response to the opioid crisis. But I think for the purposes of this report, we would need to look at potentially establishing something specific to this process in this report. However, we could leverage those existing roundtables. I'm just not sure that there is one that incorporates all the stakeholders that would be important and that are referenced by the motion.
Great, thank you for that. And also, we've heard a lot from the speakers around the role of folks with lived experience involved in co-designing that policy. Do we have any existing or examples that we can draw upon where folks with lived experience, whether it's drugs or other issues, have been successfully involved in that co-designing process?
Yes, again, Councillor Tang, there are certainly examples of where research and interviews with people with lived experience have been used to inform policy making around this issue. One of those examples would be the initial siting of the safe consumption sites in Edmonton, but also, as you may be aware, the Recover team in our branch has also been heavily involved in working with people with lived experience and co-designing solutions. And so I think that there are different mechanisms, more sort of formal academic research mechanisms, as well as that sort of community-led practitioner approach that could be utilized here to inform the report coming back.
That's great, thank you. I think I'm just trying to kind of figure out, the various pieces of the mechanisms that we do have to piece this together. I guess just perhaps the last group of questioning. In the Toronto submission, it's a joint submission between the three parties. Were they part of a task force of some sort that the work began in 2018, but I'm assuming the informal engagement kind of among the three parties and others and the community started way before that? I'm not sure who has insights on that.
Hello, it's Janetta Savalaggio speaking. We currently do not have that information, but we can definitely come back and respond back to council on that question.
Yeah, I'm just curious in terms of the structure that they had, and if there's anything takeaways that we can learn from. And then in terms of the exemptions, there's three, so then we would be falling under the exemption for public interest, correct?
Councillor, this is Tracy Ash from Legal Services. Yes, that's correct. At first glance, we would be pursuing a public interest exemption for this.
Thank you very much.
Thank you. Councillor Rutherford.
Yes, thank you so much. My question is to Ms. Kajener. In full transparency, you and I sat on a committee together for intermunicipal opioid response led by the City of Grand Prairie. I remember seeing you at that committee. Does that sound familiar to you?
Councillor Rutherford, I believe that may have been a case of mistaken identity because I don't believe that I participated in that committee.
Or did anybody on your team?
Yeah, that's quite possible. Yeah, absolutely. We have Jenny Keane may have been participating on that prior to her retirement, and other reps from the social development branch.
So the reason I bring that up is that's one example of many in which this dialogue has happened. So when I see this motion from Mayor Sohi and it says develop recommendations to reduce drug poisoning injuries and deaths in Edmonton, have we not had that discussion on multiple fronts with multiple partners already?
Yeah, absolutely, Councillor Rutherford. I think there has been a lot of discussion about best practices, whether all of that information has been collated into one place with including the recommendations from the wide variety of stakeholders and highlighting where there may be points of divergence. I don't think that has happened at council yet, but of course there has been a lot of discussion and there are a lot of well-known solutions, and I think the members of committee heard that from a number of the speakers earlier as well.
Yeah, so where do you anticipate points of diversion? I'm just, on some of is it the stigma around harm reduction? Is that where we're seeing the points of divergence? Where is that divergent thinking? Because from my experience in working in this sort of space is that there's a generalized understanding of some of those strategies that will reduce drug poisonings and death. We talk about if people are using alone, for example, that increases risk. We know that if drugs are contaminated and the toxicity of drugs, that increases risk, just as a few examples. So do we not have generalized recommendations already?
Yeah, I think certainly there's consensus, is building, but this is a relatively, new phenomenon, notwithstanding the significant impacts that we've had over the last few years. And when it comes to decriminalization specifically, as noted in the report, it is a relatively new initiative with only 2 other cities in Canada looking at advancing it. So I think it is reasonable to expect that there may not be fulsome agreement across the board in terms of support, but certainly as when it comes to the profession of public health, we are seeing some consensus emerging around specific recommendations.
Yeah, but I think I think one of the challenges, and I'll ask Mayor Sohi a question in a minute, is with this motion, is that it's really talking about 2 separate things. Decriminalization, which we heard from speakers just recently, is actually more of a police issue, and how we're enforcing or not enforcing and stigmatizing. And then the reduction of and mitigating death and harm due to opioid crisis. I'm seeing 2 separate things that are kind of put into one motion. So Mayor Sohi, my question to you is, what's the intention there? Does it make it stronger to incorporate them, or would it be better to not have those separated, since there's already knowledge, already research, already consultation that's happened on how to reduce drug poisonings and deaths, whilst also then having that motion that can work collaboratively for that exemption?
Yeah.
Can you speak to that rationale there?
Yeah, so what I envision, Councillor Rutherford, is that all that evidence is there, work is being done. It's kind of scattered around in different areas, right? As far as our advocacy is concerned, we really don't have that kind of a very comprehensive plan in place. That's what I envision out of this, right? We can bring everything together, that when we engage with our partners, we are talking about all the tools available, not just tools in a segmented way. I think that's where I have been struggling over the last 5 to 6 months when we engage with feds and province, right? That we talk about single items, but not a comprehensive approach. So that's I envision. The work will continue, right? And we're not going to stop our work, but I think this will give us, in a very comprehensive way, a report that will talk about all those things. That's my
and I get that. I think for me, it's concerning when I hear 660 Edmontonians died in a year. And this, when you look at the timeline of this and the sequencing that's proposed in this motion, how many more people are going to die in the process of having further dialogue and report? I understand that. I guess I'm going to come back for a second round. Thank you very much.
Thank you. On the second round then, I guess, Councillor Tang.
Thank you, Mr. Chair. Actually, Councillor Rutherford, I think, raised a interesting thing I have forgotten about, but thank you for the reminder in terms of some of this intermunicipal work. We know that, this crisis has affected not just Edmonton, but certainly in municipalities of varying sizes. I'm curious, Mr. Mayor, in any of your conversations, do you think there will be an impact beyond Edmonton with some of our regional partners as well? With this,
When it comes to opiate crisis, I mean, a drug poisoning crisis, absolutely. There's a impact in the region, and we are working with the region as well on a kind of social issues approach to economic growth, right? But I do want to on the other issue, like can we move fast? I would love to move faster. But the challenge is that Toronto has been working on for a while. Vancouver has been working on this for at least when I was a federal minister. They've been working on it. So things are not moving fast because of the complexity and the political realities as well, right? And divergent views. So I think we'd love to move faster, but the reality is that things are not moving faster, which is kind of a sad reality.
yeah, I appreciate that. I have been wondering around kind of a regional drug approach as a way to gain greater buy-in. I'm very conscious that there are many partners, many municipalities, in the region who's watching this conversation very closely because they are experiencing similar crisis, in their communities as well. I guess question to administration, what are some of those beyond the example that Councillor Rutherford had cited in terms of some of that intermunicipal collaboration? Do we have other examples where municipalities are working across the borders?
Councillor Tang, I'm having some connectivity issues, so I'm not sure if this question was directed to me, but there are other examples of municipalities collaborating on this issue across boundaries. One of those would be the big cities, city managers, executive leadership table has had discussions around this and is a venue for where we can continue to have those sort of municipal conversations about matters that are, cross our boundaries and impact the federal government as well. I have been able to confirm in the intervening period that the City of Edmonton does participate on that intermunicipal group that Councillor Rutherford mentioned. My branch is there, and there is, that work continues, and that's another avenue that we can absolutely leverage.
Okay, great. Oh, Miss, okay. I'm out of time though. Thank you.
Oh, okay. I don't know if I can still respond, but very quickly as well, FCM and AUMA, or now Alberta municipalities, are also forums that have been exploring this issue as well.
Thank you so much.
Thank you. Councillor Rutherford.
Great, thank you so much. So I hear your intent, Mr. Mayor, with this, and I don't disagree on the long-term pieces. I do agree that the exemption to the drug control substances is a long-term and needs that future focus. But I guess my question is, how do you envision stuff like my motion from last week around the drug testing being impacted potentially by this motion, or do you see it being impacted at all? Because I do think that is a quick win.
Oh, absolutely. I think these are many components to this, Councillor Rutherford, right? And your motion from last week absolutely is critical part of the many tools that we need to have, right? So I think that will probably supplement and maybe inform some of the work related to this motion.
Sure. So just a question to admin, this motion won't delay the work, because the timeline for that motion on the drug checking was fall 2022.
No, this motion won't delay that work. This obviously decriminalization would be helpful for drug testing or drug checking, but it's not necessary. And the report coming back is an information report, so we'll be able to provide you with that information regardless of the ongoing work related to this motion.
Okay, fantastic. And my clock didn't restart, just for the record, so I have no idea what time I'm at.
You have 1:30. I'm keeping it myself.
Perfect. Thank you very much, Mr. Chair. So that clears up my question, but I do think we really need to as we're developing this report, I think Councillor Stevenson captured it well. Like we've heard so much about our tendency to do reports and then more reports for more reports and action. And I feel like this isn't the first conversation, and when I don't feel it, I'm aware from Councillor McKean's previous motions, this is not the first time that this has been discussed, right? So and I know we're limited in our jurisdiction, and I think that's an important piece of this puzzle, absolutely. But if there is anything within our circle of control, hopefully this will shore up some of those opportunities to really make some headway in this, because it is a crisis and it does require some timely data. Because Ms. Jenner, could you speak to, is it my understanding that how the numbers have like doubled in opioid related deaths in 2021 from the latest report in Edmonton?
Yeah, we've certainly seen a significant increase since the beginning of the pandemic. And I believe last year in 2021, the number of Edmontonians who died was well over 600 people. So it certainly is the trend that's going the wrong direction currently.
Mm-hmm. And a lot of people think that it's the people that they see in LRT stations and whatnot, but a lot of the opioid deaths are actually blue collar middle class workers that overdose in their homes. Correct?
That is correct. Yeah. Yes.
Yeah. Okay. Well, I really appreciate you. Thank you for clarifying that, and I'm glad we're all on the same page about sense of urgency, Mr. Mayor. And thank you for bringing this motion forward and for keeping this ball rolling so that we can make an impact on this.
Thank you. Are there any further questions from councillors? Anyone else wishing to speak? If not, I'll move to Mayor Sohi to close.
Yeah. Thank you. I think it was about 4 years ago.
Sorry, a point of order. Apologies. Didn't click on fast enough.
Okay. Councillor Tang to speak.
Yeah, I'm very happy to support this motion. When this issue was brought up, and I'm very cognizant of a major advocacy campaign even during the campaign trail this past election. And one of the things that's been sitting with me is what happened to the past work on this. And I think it's really unfortunate that I think we've lost some of that thread. And I think, this motion is quite detailed enough that I hope it will gain some momentum. Like I said, I'm very conscious that there is a number of, municipalities kind of keenly interested in this conversation, because this is a crisis that knows no boundary, no class, gender, race. It cross-sects so many different types of people and families and communities being impacted. And I really appreciate all the speakers who came out in support of this, just to continue on with some progress. Decriminalization is not a panacea. Dr. Heshka spoke that very clearly. But if we don't do anything at this point, the inaction will simply perpetuate the crisis. Furthermore, I think, some of the past work done, for example, with former Councillor McKean's motion, that was done prior to COVID. And I think the situation has just been so much more exacerbated. I've seen this during my walkabouts in downtown, in the transit centers, and speaking to the business community, and speaking with, police officers, frontline workers, and having lots of those conversations. It is extremely complex. And I really appreciate all the considerations here. And I'm hopeful for, I guess, a different path that could emerge from this, especially with the involvement of people with lived experience in co-designing and co-creating some of these policies. So I am supportive of this, especially considering one key lesson for me in the report is how critical it is to have the city, the healthcare system, and the policing service working in tandem together on this with the support of the community. And if anything, if we can move forward on that piece in our city, I think that could be a win, and undoubtedly a key piece for moving this forward. So thank you for putting this motion on the table, Mr. Mayor. Happy to support.
Thank you. Anyone else before I go to Mayor Sohi to close?
Thank you.
Mayor Sohi.
Thank you, Mr. Chair. I want to thank our administration for working with my office in developing this motion, and also want to thank council members, particularly Council Jans and Councilor Tang, for again working with us to have this motion developed and a comprehensive approach that will lead us to a report, right? So and action recommendations. I also want to thank some of the community organizations that we reached out to in lead up to this motion, seeking their input into this. So I think it was about 4 years ago that I attended a funeral of someone who passed because of overdose. But it was very difficult for family to acknowledge and admit because of the stigma attached to it. And that was, as Councilor Rutherford was saying, was a blue-collar, middle-class worker. And the family was devastated. The stigma was attached because of shame. Stigma was attached because of criminalization of drug use, in this case, somebody feeding an addiction that they had no control over. So I think we need to think about these things in a way, what can we do to reduce that harm to people, to families, to communities? And there is a lot of harm to this. But we cannot do this alone. Our council has taken steps to address the opioid crisis, the drug poisoning crisis at a municipal level, but we cannot solve this alone. And we will continue to do our advocacy to the provincial government and to the federal government to fund many proven treatments and harm reduction measures like safe consumption sites, safe supply, mental health supports, treatment and recovery services, and supportive housing to address the systemic factors that push folks towards substance use. And having this tool available, exemptions to 56.1 exemption, will add another tool. And I know things don't move fast, which is unfortunate, but we will continue to do what we can until we get to that point. And so I really want to support our council members and committee members for asking those questions and challenging us in a way that we need to continue to do more. So with that, I'll stop here, Mr. Chair.
Thank you, Mayor Sohi. Please vote.
We have 5 votes.
Please display the vote. That is carried 5-0. Thanks again to all our speakers that have joined us on that item. Appreciate your participation today. Item 6.1 is time specific for 1:30, so we'll move to item 6.2, and I believe we have a presentation available to us. Good morning.
Good morning. Thank you very much. My name is Jennifer Keller. That's my maiden name. My Lord, haven't had that for a while. My name is Jennifer Flaman. I hope my husband's not watching. With me this morning is Crystal Kajener, Acting Branch Manager, Social Development Branch, Trina Schmidt, Supervisor, Family Violence Prevention Team, and Judy Smith, Director, Community Resources. During the fall 2021 supplemental budget, the needs of women's shelters in our community was discussed in context of the impact of COVID. In response to the motion, administration met with the Alberta Council of Women's Shelters and some of their Edmonton membership. At this time, they identified funding they required, but also discussed ways that the city can work more effectively with the group. Crystal and Trina will provide a brief presentation on the work of domestic violence in our community.
Thank you, Ms. Flatman, and good morning, members of committee. Over the next few minutes, I'm going to provide you with a brief overview of the incidents of domestic violence in Edmonton, while my colleague Trina Schmidt will provide you with some information related to the communities and the city's response to the problem. Domestic violence is a pattern of behavior in any relationship that is used to gain or maintain power and control over an intimate partner. Women are disproportionately impacted by this issue, as are Indigenous women. But we also know that domestic violence can impact anyone and cuts across socioeconomic, cultural, racial, and class distinctions. Too often, domestic violence includes patterns of controlling behavior and abuse that escalate over time and may lead to homicide. In Canada, a woman is killed by her intimate partner approximately every 2.5 days. Domestic violence rates tend to increase during periods of widespread stress. As in the case of emergencies and disasters, the COVID-19 pandemic is estimated to have increased the incidence of domestic violence between 25 to 30%, which has prompted the UN to declare the issue a shadow pandemic. Although we depend heavily on police data to understand the prevalence of domestic violence, studies have shown that in the case of 70% of domestic violence victims, the police were never made aware of the abuse. Next slide, please. In Edmonton, during the first year of COVID-19, Edmonton Police Service reported an overall increase in calls for service regarding domestic violence. The numbers increased from 8,155 calls for service in 2019 to 9,378 calls in 2020, or about a 15% increase. During this period, the Edmonton Police Service also noted that overall severity of violence that they were responding to has increased, and we also saw a 10% increase in the number of emergency protection orders issued. Similarly, support and information lines reported a rise in third-party callers looking for supports for their friends or family member. The police and community's response to domestic violence was also challenged by delays in court proceedings and the accelerated release of perpetrators due to the impacts of the COVID-19 pandemic. Stakeholders have identified a number of long-standing gaps in the existing response to domestic violence. And while not new, many of these gaps were also exacerbated by the pandemic. Each of these gaps contributes to the increased likelihood of violence occurring and can prolong victimization by undermining the agency of victims. Gaps commonly cited by service providers who work with victims include a lack of access to financial supports, a lack of affordable or subsidized housing options, the increased need for mental health services, an increased need for access to technology, which was obviously exacerbated by the pandemic, and an increased need for addiction supports. Next slide, please. Most female domestic violence victims use their own informal networks for support. Friends and family, by their very nature, can be more easily accessed as resources than more formal organizations. In terms of formal services accessed, however, the most frequently reported type of formal victim services that domestic violence victims use are a counselor, psychologist, or social worker. The next most frequently reported formal services are crisis centers or phone lines, victim services or witness assistance groups, women's, men's, or senior centers, and support groups, and finally shelters and halfway houses. Shelters provide an immediate safe location for women fleeing violence and are an important connection to resources, but they can also not solve the problem on their own. We know that according to Stats Canada, who recently completed a snapshot of shelter stays, over 50% of the women who left a facility on that day were either returning to accommodation with their abuser or leaving with no set housing destination and are effectively homeless or at very significant risk of homelessness. Next slide, and I'll pass it over to Trina.
Thank you, Ms. Kajener, and good morning, committee. Governments play a critical role in violence prevention. In Canada, physical and mental health care are the purview of the provincial government. The government of Alberta has a multi-ministry response to family violence prevention, from child abuse to domestic violence and elder abuse. Their response ranges from providing awareness, raising and education, along with resources and tools, to funding of direct programs and services such as the 24-hour Family Violence Information Line, the Escaping Abuse Benefit, and providing sustainable funding for community agencies such as women's shelters and community networks who support a coordinated community response. Municipal governments, however, are the order of government closest to the people in the community, and therefore are uniquely positioned to be aware of and responsive to the needs of the community. Next slide, please. The City of Edmonton clearly articulates its commitment to violence prevention in the city plan, which notes that the city strives to promote opportunity, equality, and personal safety for women, girls, and gender minorities in Edmonton. And our work in domestic violence prevention advances the corporate goal of healthy city. Through the work of the Social Development Branch, we have a long history of supporting broad cross-sector collaboration and community-based programs to advance violence prevention efforts. In 2021, through the FCSS program, $1.9 million was provided to agencies whose mandate is to directly impact or directly address this issue, such as Community Initiatives Against Family Violence, the Sexual Assault Center of Edmonton, and the Gender-Based Violence and Sexual Assault Prevention Initiative. The funding also went to other agencies whose programs and services support prevention, such as parent education and support programs and drop-in counseling. We see domestic violence through an intersectional lens, and given this, we work across both the Social Development Branch as well as the corporation to ensure an integrated response. Also, the City of Edmonton is a member city of the UN Women's Safer City and Public Spaces Program and dialogues on a regular basis with other Canadian city members to share approaches and gain new learnings. Next slide, please. The City of Edmonton is a leader of a municipal response to violence against women and girls. I'm the supervisor of the Family Violence Prevention Team. Within that team, we have 7 social workers dedicated to the Domestic Abuse High Risk Team, which is a long-standing partnership with Edmonton Police Service, and they respond to some of the most severe cases of domestic violence. We also have 3 community social workers focused on family violence prevention, elder abuse prevention, and engaging boys and men, and a social planner who helps us lead on the gender-based violence and sexual assault prevention initiatives. We know that no single factor can explain why interpersonal violence happens. This is an issue that occurs because of complex interplay between individual, relationship, community, and societal factors. And thus our response needs to cut across many levels at the same time to achieve a population-level impact. Our team has 5 areas for action which we focus on: research and best practices, which are foundational to our response and to share with the community. Individual support to citizens, as I noted earlier with our domestic abuse high-risk team, we are responding to individuals who are at the highest risk of domestic violence. Through education and awareness, we are supporting to change social norms and attitudes that support violence, and we are specifically focusing on engaging boys and men as allies. Partnerships and community mobilization is key. Work with other orders of government, community organizations, and businesses to strengthen community capacity and deliver preventative programs is important. And of course, systems change. We need to look at and affect policies to create a better response. Our team also works closely with the Indigenous Relations Office and will be supporting the recently approved action plan regarding missing and murdered Indigenous women. It is important to recognize the City of Edmonton is working in partnership with key stakeholders to help reduce domestic violence and the impact on families and our community. The pandemic has highlighted how quickly things can escalate and has amplified the gaps that remain in the system, including access to shelters, supports, and affordable housing. We will continue to leverage our internal resources to work in partnership towards a coordinated response and changing social norms and attitudes. Council support of the action plan in addressing missing and murdered Indigenous women and girls is a significant step in addressing this issue. Thank you.
Thank you. We'll now hear from our speakers. Now, was there a person that had a time constraint on this panel? There was some mention of that earlier.
It was for 6.1.
Oh, okay. Okay, then we'll worry about that this afternoon. Thank you, Councillor Tang. So thank you, all of you that have registered to speak today. Just a reminder that you each have 5 minutes, and we'll hear from all of you before we go to questions from Council. So first we have Leslie Allen, followed by Karen Kingdom and Shakia Khan. Ms. Allen?
I'm sorry, Ms. Allen let us know she'll be unable to be here today, Councillor.
Okay. Then we'll go to Karen Kingdom, followed by Shakia Khan and Jan Reimer. Ms. Kingdom, are you here?
I am.
Terrific. Please go ahead. You have 5 minutes. Thank you.
Well, thank you for the opportunity to present to you this morning. My name is Karen Kingdom, and I've had the privilege of being on staff at Wings of Providence for 30 years. Currently, my role here is that of program coordinator. Wings is the second stage, that means long-term program for shelter for women with children leaving intimate partner abuse. The families reside in furnished apartments. All our families are below poverty level. While at Wings, the families participate in our wraparound services that focus on everyone in the family from preschoolers, school age, teens, and moms. All age groups have group programs that focus on healing and creating safe and happy family. We have a lean staff, and most of our funds come through fund development, grants, proposals, and our dear friends who donate faithfully. Trauma happened to the family, and healing happens with the mother and children together supported in a safe environment. Most of our families score extreme high risk on the Dr. Jacqueline Campbell Danger Assessment Tool, which measures lethality. In the past year, 82% of our women were high risk in lethality. Safety and saving lives is always a priority, along with ongoing risk assessment and safety planning. The women also meet weekly with a support worker who helps them navigate the legal system to obtain protection orders and family law matters. This is very complicated and stressful. Most of our women would not proceed with these processes on their own. It would be far too overwhelming. Our group programs focus on family violence, parenting group, personal growth, as well as health and wellness. We have diverse cultural population. Many of women were not born in Canada. Often they come to Canada not speaking English and are isolated, so they cannot reach out for help or have resources to tell their story. Most are permanent resident status. Often were well educated in their home country. Immigration status can be a challenge that impacts their safety and ability to access services. Some of our women are Indigenous whose families have suffered greatly due to residential schools and intergenerational traumas. Some of our women have been through the system from an early age. Given the intense trauma histories, it's not unusual for our women to also have overwhelming mental health and even addiction issues, ways they cope with overwhelming circumstances. Healing is complex and takes time and skill. All of our staff are trained in trauma-informed practices and their role in their various roles. Our moms usually have a deep desire for independence and desire strongly to make a better life for their children. This year, we are grateful to have added a nurse practitioner to our staff. She facilitates the health and wellness group. She provides assessment and effective intervention. This demands long-term services. She's integral in our team approach to prevention. Obviously, she provided informed and effective measures in our response to COVID. She has been essential in our coordinated response to mental health and addiction. The moms trust her and have attended to many health needs that would have been neglected had they not had her assistance. This position is paid by Wings fundraising. She's essential in supporting moms with complex health issues and children, whether due to trauma or not, and in navigating the healthcare system. Women's health is always a focus. Much happens, and there's much more to be done. Funding is necessary for services to continue and for new program dreams and services to emerge. The women and children at Wings need more advocates. Thank you.
Thank you. Next we have Shakia Khan, followed by Jan Reimer and Patricia Vargas.
Thank you for allowing me to speak. My name is Shakia Khan. I am the regional manager for Nisa Homes in Edmonton. Nisa Homes has 8 locations across the country, but we've been in Edmonton for 3 years now. Our current capacity is 12 women plus children, and we often have a wait list of up to 8 families, and at one time reaching a wait list of 14. Nisa Homes is different from other shelters as we're not emergency or 21 days, but rather 3 months stay with the high success rate of our clients moving into independent housing after our program. We cater to individuals with refugee status, new immigrants, and even non-status, and we serve with a culturally sensitive lens for all our clients. Nisa Homes is not government funded, nor have we ever been. We only recently started receiving provincial and federal grants after the start of the pandemic. We get all our support from community donations and connections, and our biggest fundraising time of the year is during the month of Ramadan. As an organization, we adopted a new program called Remote Casework during the pandemic. This meant we were helping clients with immediate needs outside of the home without having them actually move into the shelter. Our caseworkers would work overtime and outside of the office to accommodate the added caseload aside from their regular clients in-house. We couldn't keep up with the demand on the ground and we couldn't house everyone. Even with this new program, we still had an additional ongoing wait list just for remote casework. We need funding for our operations. We need affordable housing for low-income families and a lot of support, especially for non-status individuals. We need appropriate funding to keep up with the demand in Edmonton as it is still increasing. Non-status families tend to be referred to Nisa Homes quite often and tend to stay with us longer than the 3 months due to their situation. We assist them with applications and try our best to get them work permits or temporary residency permits. They must be extra careful because they have no income and are not covered medically. They can't work or attend classes and their children cannot go to school here. Our staff tries their best to help make life seem as normal as it can for these families in these shelters. There are only a few housing programs that accept clients with non-status as tenants, and they still charge rent. How can a woman who is legally not allowed to work here afford rent? I had a client that was a nurse back home. She came here with the promise of being sponsored, but after her visitor visa was expired, her partner chose not to sponsor her. Her career credentials had no merit here, but she was not shy of working for a living. She worked for cash, cleaning people's homes and taking care of seniors and even doing yard work. She would take as much work as hours would allow while still making spending time with her 10-year-old son a priority. She had to make $550 in the month to afford the rent at Catherine Drexel Housing for a 2-bedroom apartment. That's all the money she would have, and she had to use whatever was left over for groceries, bus tickets, anything for her son, any medicine, anything and everything. Luckily, this time was during the summer in Edmonton, and she was able to find enough work. What if this was happening to her during the winter? What if we couldn't find those community connections that were willing to hire her for cash? As much as we all do and as much as we would want to do, the fact is that due to lack of funding, lack of space, and lack of resources or staff, we are at risk of failing these women and children. Without structure, we are not able to support them, and they may hop from shelter to shelter before they really end up on the street or give up and go back to the environment which they came from, because somehow their old situation starts to seem not so bad anymore. Thank you.
Thank you. Next we have Jan Reimer, followed by Patricia Vargas and Sue Languedoc. Ms. Reimer. Oh, sorry, we can't quite hear you. Just a second. Sorry.
It does look like Ms. Reimer is unmuted, but we still cannot hear. You may want to try leaving the meet and then rejoining and or phoning and using the number provided.
Can we hear? Yeah, perhaps try leaving and joining us. Can we hear Ms. Vargas?
Can you hear me?
Yeah, we can. Why don't you
Oh,
go ahead
good.
and we'll circle
Okay.
back. Great, thank you.
Thank you so much. Thank you for the opportunity to increase the awareness about the work that shelters have been doing for the past 2 years during the pandemic and highlight maybe some of the things that we need to attend to as we move forward with the recovery. My portfolio, I work for Catholic Social Services and I work providing a continuum of services in the area of family violence, from shelters for women who are transgender, at risk of sexual exploitation, human trafficking, to providing services to seniors who may be vulnerable to abuse. Within the portfolio, of course, I have the 3 shelters that provide services to women and their children who are escaping violence. Lorena is the emergency shelter and it has 32 beds for women and their children. And then we have LaSalle with 12 apartment units and Drexel Place, which is 3rd stage place for women and single women, women with children and without children. And their stay is about a year. Overall, in the past 2 years, while some of us were sent home to work from home because of the orders, shelter stayed open and provided face-to-face services to all those women that came asking for support. What we looked at the pandemic and the shadow pandemic is while women were being told to stay home because home is safe, they were actually being locked in with their abuser. They were isolated from their families and friends, and they had really no one else who can provide a lifeline. And that is why we've seen the heightened issues and calls for support. I just want to say that within the last fiscal year, we supported about 418 women and children that came through the shelter. We turned away double that. We have 70% of the women and 70% of the women had COVID in our 2nd stage house. We had moms that had sometimes had 2 or 3 times COVID. 40% of the staff ended up contracting COVID. And this March, in our emergency shelter, one of our childcare workers passed away due to COVID. It has always been challenging for women to move forward, to live independently, free from abuse. There's a myriad of barriers, then we all know about them. You may have no rental history, bad credit, you can't find housing, but most of all, they don't get enough money from support services to find a successful rental place. Rent prices, as we know, have been steadily rising over the past year, and income remains painfully low. We have women right now. If a woman is lucky to get $1,200 for rent, utilities, food, everything for you and your children. So we know that even if they're successful, women are at risk of homelessness because they just cannot make ends meet. This is just too difficult for them to move forward. I think moving forward, we've seen that the toll that fear, being already in a trauma situation, leaving abuse, having the strength to actually leave that behind and hope, plus having crisis of COVID, being infected, not seeing hope for the future, that has really, really impacted women. We have a lot of women who are extremely depressed about what life looks like in the future. We need to do something about it. Women with precarious status, of course, they come to us for support. These women come to us, they have children who are born here in Canada, so their only option is either you go back to your country without your children or you live here in a state of charity. Cultural supports, as we know, race relations, the finding of clandestine burials in the residential school have added to the trauma experienced by women that we serve. And it's within this landscape that we have been operating the shelters in the past few years, 2 years. Addressing all these needs will be important for us to move forward. Thank you.
Thank you very much for your presentation. We'll circle back to Ms. Reimer. Oh, you're still on mute, Ms. Reimer.
Okay, is this working now?
There we go. Yep. We can hear you.
Okay.
Terrific. Thank you.
Well, thank you for your patience, and thank you actually for being prepared to look at this issue today, and to listen to those agencies who really have that frontline expertise to make a difference in women's, children's, and seniors' lives. Women's shelters in Edmonton have really been building on a body of knowledge for over 40 years. And I think that when you look at council addressing it, their involvement here today is critical. The Alberta Council of Women's Shelters ourselves is a not-for-profit organization that supports 40 members that operate 50 shelters and deliver services across the province for women, children, and seniors. And we work to share knowledge and domestic violence through culture shifting programs, do collective data and research, and frontline training. And that's how we're able to work together and avoid, I think, a great deal of duplication of effort. We've also worked with women's groups across the country to craft a comprehensive implementation plan for the National Action Plan to End Gender-Based Violence. And I would really encourage members of council to take a look at it. You can find the detailed plan at the nationalactionplan.ca, and it has recommendations for all levels of government. And I'm sure in particular, you'll find those around police oversight, transportation, and housing of particular interest. Many may not realize when allocating scarce resources that even with the significant underreporting that the administration identified earlier, Stats Canada has reported that almost a third of all police reported violence happens between intimate partners. As the community services report demonstrates, domestic violence is a serious and urgent problem, and it requires a coordinated response, client-centered supports that ensure accessibility and equity. And that's what this funding will help to do for women here in Edmonton. Pat talked about the messaging about stay home, stay safe, and the impact of that. We also know that it added to the vulnerability of seniors, and the cost of living impacts that we're now seeing also add to those who have an increase of their dependency on abusers, including immigrant, newcomer, refugee, and Indigenous women. We also know that domestic violence has significant health impacts, both physically and mentally. It is a pathway to addictions as well, and you had a lot of time speaking about that earlier today. Some of the ways the increase in severity of abuse manifested itself during the pandemic was through strangulation and concussions, all of which have impacts on women's health and that of unborn children. We also know that a child's exposure to domestic violence can impact the very architecture of the brain, and shelters work as well very closely with children. While Edmonton's demonstrated strong responses to homelessness, it did have the result of leaving domestic violence and elder abuse shelters far behind. Most women do experience homelessness as a result of violence and trauma, and and domestic violence is a key pathway to homelessness. And accessing their housing they can afford is a key component of prevention, along with wraparound support. The provincial policy of substantially reducing capital housing dollars allocated to women's shelters meant that for close to a decade, no new capital dollars were invested while Alberta's population was skyrocketing. Indeed, the cancellation of the Women's Shelter Enhancement Plan as part of the 10-year plan to end homelessness. So only PEI and the Northern Territories get fewer dollars than Alberta shelters. Clearly, more support is needed for women who are at increasing risk of homelessness due to the impact of intimate partner and domestic violence, especially those with intersecting identities that make them more vulnerable to the effects of domestic violence. The significant underinvestment in housing first on domestic violence has also been shown in terms of the point system that disadvantages abused women, as do many of the social housing policies. No priority for social housing, for instance, as in other provinces, and minimal access to the portable housing benefit and the use of the National Housing Guidelines as standard. The focus on the housing first strategy has been geared to men, in my view, has contributed to the increasing numbers of homeless women that we're now seeing on the street. Domestic violence shelters have frontline expertise in responding to survivors and helping them transition to lives free from violence and abuse. They do have a significant impact on women's well-being. All these organizations now are in dire need of support. As the report outlines, and as you've heard, COVID-19 has impacted their ability to fundraise and make up budget shortfalls and continue to offer life-saving programs and services. They also do a lot of preventative work, whether that is in prevention of homelessness, victimization, trafficking, building resiliency in children, or preventing communicable diseases from STDs to COVID. But what often isn't talked about is as you invest in prevention, you also increase awareness, which also sees an increase in demand. It tells you how critically shelters do need your help. You've heard from our members on the impact they have, as well as the unmet women that have found the courage to end their abusive relationship. They also are very adept at connecting with community-based services to better meet those needs, and we hope that we will provide them with the very much needed support they require. Thank you.
Thank you. We'll now go to Ms. Languedoc, followed by Cindy Furlong.
Thank you. Can you hear me okay?
Yes, we can. Go ahead, please.
Oh, good. Okay. Thank you, Council, for allowing me to come today to speak. My name is Sue Longdo. I'm actually the past chair of the Community Initiatives Against Family Violence, which is called Kiev. I'm also executive director of Aboriginal Counseling Services Association of Alberta, and we provide the Circle of Safety Family Violence program here in Edmonton for Indigenous men, women, and children impacted by domestic violence. We're the only Indigenous organization in the city that provides services to men, women, and children. And we've also found that through COVID, the need for services has gone way up, and we certainly have been experiencing wait lists for people to access our services. I just want to give you a little bit of a history of Kiev. And community organizations in Edmonton have actually been meeting for well over 20 years to address the issue of family violence in Edmonton. First, over 20 years ago, was the Interagency on the Spousal Abuse of Women Committee, which eventually evolved into the Mayor's Task Force on Safer City, which was called ECAV, the Edmonton Community Against Family Violence, which eventually evolved as well into what Kiev is today. And when I think of Kiev, I think of grandfather tree. When I think of the roots of that grandfather tree, those are the people in the community that are needing supports, needing services. And they come to the membership. We have over 45 members in Kiev. These people that are accessing services in the community come to the membership and teach us about what their issues are, teach us about the challenges that they have. Those membership people bring that up to the Kiev Leadership Council. And the Leadership Council is a group of people who can move the needle, make a difference in the community by addressing certain social issues. So the Leadership Council is the ones that try to make those changes on behalf of the voices that we hear from the community. So the roots are the community, the membership is the trunk, and the leadership are the branches that reach out to try to influence systemic change. Some of the things that Kiev is involved with is we're part of the provincial collaborative to end domestic and sexual violence. Kiev also provides education and community training through their PAIR program. We also sit at the committee for the Strangulation Identification Action Committee, as well as the Immigrant Family Violence Prevention Committee. We're grateful to the City of Edmonton and Edmonton's Family and Community Support Services who do provide some funds for Kiev. Kiev's members know that we are better together and that we need to support each other as we address family violence issues for all citizens from all cultures in Edmonton. With COVID, a community coordinated response to family violence is more crucial than ever before. Kiev's membership provides services to individuals experiencing abuse. That includes children, individuals using abusive behavior, male or non-binary individuals, the Indigenous community, the LGBTQ+, the ethnocultural individuals, and those individuals that are disabled. This inclusivity and intersectionality forms the basis of a collaborative approach to ending family violence. As I reflect upon the 30 years I've had working in the Edmonton community and over 20 years of being on family violence committees in Edmonton, I always have tried to stay true to what the elders have taught me. They taught me that we must work together to build bridges and support the development of allies between the Indigenous and the non-Indigenous communities so that we can create a safer, gentler world for all of Creator's children. Thank you.
Thank you. Next we have Cindy Furlong.
Hi there, good morning. My name is Cindy Furlong, and I'm the co-chair of Community Initiatives Against Family Violence, Council of Service Providers. I'm also the executive director of the Today Center, which is a community-based organization working with individuals experiencing family violence. On behalf of Kiev's Council of Service Providers and its members, I would like to thank the committee for allowing both you and I to be here today and for your concern in addressing family violence in our city. Dubbed the shadow pandemic, we know that incidents of family violence have intensified during COVID-19, often intersecting with other social issues such as mental health, addiction, poverty, and unemployment. Rising numbers have put a strain on many of Kiev's member organizations who similarly rely on grants, fundraising, and donations to operate and provide services. They too have struggled with the impact of public health restrictions on in-person programming and fundraising opportunities. Through our work, we know a range of formal services is often required to support an individual and their children experiencing abuse in the home, including mental health support, cultural support, legal, financial, housing, and health services. 2014 Statistics Canada, data showed that the most frequently reported type of formal service that victims used was that of a counselor, psychologist, or social worker at 32%. The report further showed that less than 10% of victims access shelter as a formal service. So as a community working together to end family violence, the modern day environment is an important factor to consider as decisions about where financial support is rendered. Through our presence here today and through the letter that Kiev sent last week to the Mayor Sohi and city councillors, we kindly ask that the Community and Public Services Committee acknowledge that all family violence agencies have struggled to keep the doors open through the pandemic. Kiev also respectfully requests that your support considers the broader context of what's happening throughout the community as we all help to provide support to those experiencing family violence. Thank you very much for your time today.
Thank you. We'll now go to questions of our speakers. And I'll go first to Councillor Wright, who exempted this item. Go ahead, Councillor Wright.
Thank you very much, Mr. Chair.
I had requested this report as a result of from budget deliberations where city police were telling us that the increase in family violence calls had gone up 7%, and I was sort of looking more of a preventative way so that people could not that women experiencing the violence wouldn't have to take it to a police matter. And I'm just wondering, is there other preventative measures that could be taken, or what support do the women's shelters provide to, I guess, prevent escalation of these matters?
Do you have someone that you're wishing to address that?
In particular, maybe I'll go to Ms. Reimer, just because she is sort of the oversight of the women's shelters in Alberta.
Not necessarily oversight, we very much collaborate, but shelters do all sorts of work around, preventing escalation. Indeed, when I think Karen Kingdom talked about the danger assessment, we know that when they use that danger assessment, women are more likely to seek help, they're more likely to connect with child welfare if need be, and they're more likely to connect with the police. We also know that it's a great educational tool for them to be able to understand the nature of their abuse. And that has made a huge difference, I think, in many, many women's lives. What may not have been mentioned is that we're also working with Dr. Jacqueline Campbell from Johns Hopkins to also enhance the danger assessment tools as it relates to both newcomer refugee populations and the 2S LGBTQ populations, and further refine the danger assessment circle that we've worked on with the on-reserve shelters in Alberta, which is now being adopted in many areas. So that's one element of just recognizing that. I would say another huge area would be around prevention with children and the work with children. When you walk through shelter doors, the first thing you're most likely to hear is children's voices. And we know that, violence impacts the very architecture of their brain. So building the resiliency of children is critically important. Women reach out to shelter. It's not their preferred place to be, right? It's really where they know they have to be to save their lives. And you can only imagine what it must be like to get that courage to phone the shelter and then find out that they can't come in because there's a lack of space, or what it's like day after day as the shelter staff to hear that. So the capacity issue is a huge one. But I think shelters have also been very adept through Kiev and other agencies to look at how they can use those resources to facilitate that, whether it's working and engaging, elders to support women, because we know again about the value of culture in healing, or whether it's working with mental health and addictions, which are in short supply. But these are really vulnerable women who really need their support. I could speak for a long time on the different preventative elements that we do as well. Our leading change is our major call to action. But I think, if you want to, I think both Pat and Karen in particular could really speak to some of the frontline impacts that they see as well.
Thank you very much. Just in the minute that I do have left, administration's report talked about sustainable funding coming from the province. Perhaps if maybe Karen or Pat could speak to, has it been sustainable?
Yeah, I can certainly answer that. I think we received an increase in 2015 of positions. I think when you talk about sustainable, it's just it hasn't changed for since 2015. So the fact that we received the same amount doesn't really. Yes, we do receive the same amount. Whether it's an appropriate, sustainable amount, no. I mean, we are expected to fundraise.
And Karen, did you have any?
All I know is like the rest of Albertans, power has gone up, everything's gone up, heat, whatever, and we still are receiving the same funds. And it's very, very difficult to provide all the services that we would still like to provide.
Okay, thank you. I think my time is done.
Thank you, Councillor Tang.
Thank you, Mr. Chair. I'm cognizant right now, this is reports for information only, so I don't know if there's any emotions in the work. I am keen to hear from my colleagues on that.
My understanding is that there's a motion coming when we circle back to administration.
Perfect. Thank you so much. So thanks to all the speakers. Periodically our ward office gets pleas for help from constituents, one as recent as this past Friday. And I want to thank, all the frontline providers, folks who are, dealing with the women in some very precarious situations, facing eviction, loss of job, while still having to care for their children and trying to, escape very challenging domestic situations. And I see that coordination as well with our city folks. So I really just want to say how much I appreciate that network of support that you all provide. I recognize that in some cases people reach out to us because they don't know who to reach out to, despite so many of you here providing that service. I guess Ms. Reimer, can you speak a little bit to that gap, of that information gap?
It's really hard. I think when you're in systems now, that you have to hire systems navigators to figure out how to navigate the system. We know we have a complex system.
Yeah,
we've been doing a bunch of public awareness about what the work that shelters do as well, both in a number of different languages to reach out to those communities that don't speak English. But our most recent one is the More Than campaign, where we've joined with shelters across the country to talk about the work that shelters do. It is complex, and shelters have to really understand how so many systems work, from housing, EPOs, policing services, all of that. And so you can imagine how challenging it is for women as well. So
absolutely. Thank you so much for that. So I do want to flag that there's certainly a lot of work, and I imagine too it is stigmatizing as well to access services as well. Ms. Kingdom, you mentioned that you had a nurse practitioner that's recently funded. Is that through AHS? No, I see heads shaking.
It is not through AHS. That is our own funding that we fundraised to have her, because we know that health issues are essential for women's basic safety. If they can't get healthy bodies, it's very difficult for anything else to start happening. Many of our women have neglected their health for years, whether that has to do with women's issues. Strangulation was mentioned. We have lots of head trauma, not to mention addictions and mental health. And the children also have complex issues, but that is something that we just see as essential, and so we are willing to provide it.
So is that common for nursing support not to be funded through our provincial healthcare system? I see Ms. Vargas nodding head. Do you want to respond?
It is common. It's the usual.
Okay. Well, thank you. I have a question for Sue. I'm sorry I missed your last name there, but about Kiev. Just in terms of that coordination, among so many partners that you've been working with over the years, does the group have a common set of measurement framework and that kind of stuff that all shelter providers kind of report on across the board?
If you're asking about the shelters, I'm not sure about that.
Sorry. Maybe I'll reframe that. Maybe not shelters, but just folks working in the space of family violence.
Yes, we have principles of practice, and we have understandings, and we have a plan that is set in motion every year to look at what are the trends and issues and barriers that the community is facing what are the action pieces that we're going to take. It's usually a facilitated discussion that, and we also have an annual members meeting where we discuss what are those issues coming up, what can we do about them, and how can we move them forward. So it's very much a coordinated, collaborative voice, especially because there's so many people that sit on that committee that are from Children's Services, from probation, from police, and certainly a number of community agencies. But there's Kiev has a coordinator that provides that, as well as a fiscal agent, which is a line, and we have some very strong structure that ensures that we're all moving ahead in the same direction.
That's good to hear. Thank you so much. I'm out of time.
Thank you. From what I can see, that concludes questions of our guests today. Seeing if there's any others. Okay, so thank you again very much to everyone who joined us this morning. Appreciate you offering your comments and your presentations. So we're at the noon break. We'll be reconvening at 1:30. We have a time-specific item at 1:30. That's the Problem Properties Initiative. And we will be working on that item to its completion. We'll then return to this item for questions of administration and any motions that might be coming. And then after that, we'll be getting to, if we still have time, we'll get to item 6.3, which is the speed zones matters. Thanks, everyone. See you at 1:30. Good afternoon, everyone. We'll call the April 11th, 2022 meeting of the Community and Public Services Committee back to order. And start with a roll call of committee members. Councillor Jans.
Here.
Councillor Tang.
Here.
Councillor Wright.
Good afternoon.
And we're joined by Mayor Sohi as well.
I'm here.
I'll just scroll through the list of attendees to see if we have some other councillors joining us today. Councillor Salvador.
Hello.
Hello, good afternoon. Councillor Rutherford.
Hello.
Hello, Councillor Principe.
Good afternoon.
Good afternoon. And that's all I see for the moment. So thank you everyone for joining us. We're now moving into item 6.1, which is Problem Properties Initiative Update. There is a presentation available and we have several speakers on this item. So let's move into the presentation, please. Thank you.
Thank you very much. The report presented today is an update on the progress of the Problem Property Initiative that also includes a secondary motion made at committee in December 2021. We have a large group with us today to present this complex issue. We have David Jones, Branch Manager, Community Standards and Neighborhoods, Kim Petrin, Branch Manager, Development Services, Urban Planning and Economy, Kate Watt, Branch Manager, Assessment and Taxation, Robert McAdam, Deputy Fire Chief. We also have joining us virtually Dr. Chris Sikora, Northern Alberta Chief Medical Officer, Shauna Grimes, Superintendent, Edmonton Police Service. Additionally, joining our city colleagues, we have representatives from Alberta Health Services, Edmonton Police Services, and the province of Alberta to virtually answer any questions along the way. From Alberta Health Services, Ken Dong and Darcy Garchinsky. From Edmonton Police Services, Ian Smith. And Chip Sawchuk is joining us from the province of Alberta. Chip is the manager of the Sheriff's Branch, Investigation and Enforcement Operations, as well as Tim Rediff, Alberta Occupational Health and Safety. Thank you. I'll now pass it on to David Jones to present.
Good afternoon. Before I start the presentation, I just wanted to make one quick correction to attachment 4 of the report. On page 2 of attachment 4, the total cost 2017 to 2020 should read $1,064,907. And on page 5, because of that adjustment, and it's just an interpretation of a data set by a different group, the value of uncollected taxes for the last line that currently reads 566,000 and change, that should read 249,130, and apologies on that correction. Next slide, please. Problem properties are a complex and challenging issue in Edmonton. Administration works with communities, not-for-profit organizations, and external partners in order to identify, mitigate, and serve the unique needs of problem property files with consideration for biases, lived experience, and long-term outcomes. Next slide, please. A problem property is currently defined as properties that have significant detrimental impact on the health and safety of those living in and or the surrounding community and neighborhood. These properties have a history of recurring violations relating to safety codes, nuisance conditions, developmental permits, fire risk, and other illegal activity or criminal offenses. These properties require more than one agency or department of the city to address the core issues and gain compliance. Next slide, please. In 2020, administration brought forward a report on the update to the Problem Property Initiative actions and indicated that work on a framework and strategy would take place to continue to move the efforts forward at addressing problem properties. To date, 22 of the 29 actions that have been completed, with the remaining to be completed by the end of 2022 on target. Next slide, please. So who works on these files? The working group meets every week to decide what properties to investigate together as a unit. Joint investigations allow our teams to apply different levers to lower the risk of the properties and gain compliance. On a positive note, the graph on your screen shows that although the number of problem property inspections has increased substantially since 2018, our collective efficiency in addressing those files has also continued to increase. Next slide, please. In addition to the frontline work, throughout 2021, administration has been focusing on a human-centered framework to identify, prioritize, and prototype solutions focused on problem properties and moving forward. 4 prototypes were run through this Recover framework, which is part of the social innovation process. The prototypes focused on a dedicated office for the Problem Property Initiative, improving processes for enforcement, development of a tenancy toolkit, and drafting a logic model to identify short, medium, and long-term outcomes. This process will continue to be used for any future ideas or solutions brought forward to the Problem Properties team. Next slide, please. In addition to the prototypes, the Community Property Safety Team is a 60 to 90-day pilot program aimed at addressing unsecured vacant properties using the National Fire Code. Failure by owners to comply will result in near immediate action undertaken by administration at the owner's expense. Next slide, please. In addition to the prototypes, a case study was conducted of 31 problem properties over 5 years. The cost of the inspections, re-inspections, and enforcement calls over the 4 years was approximately $295,662. Additional costs of other EPS responses, fire suppression, deployment, fire investigations, fees and costs added to property taxes and uncollected taxes add significantly to the cost of addressing problem properties. There are other costs that could also be added that were not able to be included for the purposes of our case study, including other administrative costs such as dedicated staff and responses such as ambulatory care. Next slide, please. When one of our teams has to go to an address, the 31 case study properties had more than 5,800 touch points when fire suppression deployment, fire investigations, and EPS responses are included. Additional touch points including cleanups, needle pickups, demolitions, legal involvement, additional taxation involvement, and calls to 311 are also part of the process. Next slide, please. The next steps in the report outline administration's goal of finishing the 7 outstanding items in the action plan, identifying funding opportunities, and finalizing a strategy to guide future work based on what we've learned. Next slide, please. Thank you, and we're happy to take any questions you may have.
Thank you. Thank you for the presentation. We'll now hear from our speakers.
May we have a motion to add the
Oh, yeah, right, sorry.
Jane
So first
Sampson?
of all, we need to add a speaker that's just recently registered. So I'll move that we add Jane Sampson as a speaker to this item. Please vote on that, first of all.
In favor.
Vote's just coming now. We have 5 votes.
Please display the vote. That's carried. All right, so first of all, as a reminder to our speakers, those of you in person, each person has 5 minutes to speak. Those of you in person will see the lights on the walls at the 2 speaking stations. Green for the first 4 minutes, yellow for the final minute, and red when 5 minutes are up. We have quite a number of speakers to get through and still a fair bit on our agenda, so we ask that you really respect that 5-minute time limit. For those that are online, same time limit applies. You might want to keep a timer for yourself, but there'll also be one displayed on the window. So we are going to start, and just for my council colleagues, we're a little bit out of order just to accommodate some schedules. So we'll start with Anna Bubel, or Bubel, I'm sorry if I've mispronounced your name. And then we will go to, I'm sorry, Karen will be first. Karen Gingras will be first. Anna Bubel is only here to answer questions, and Christy Morin will be second. Do I have that right? Okay. Okay, so to Karen Gingral first, you have 5 minutes. Thanks for being here. Please proceed.
Thank you very much for the opportunity.
Oh, just a second, we've lost your mic. It was there and now then it left.
There we go.
Okay, yeah, please go ahead.
I do have a PowerPoint presentation as well that I've been told is available.
We're just pulling it up for you.
Mr. Chair, just a point of order. At the beginning of the meeting today, I had asked if Ms. Grasso can speak first, as she had to extend her lunch break. I don't know if that was taken into consideration with the reordering.
No, it wasn't. I have Ms. Grasso in person, though. Is she here?
It's okay, she can go.
Okay, it's okay, Councillor Tang. We've all sorted it out here in person.
Perfect.
Okay?
Thank you.
Okay, please go ahead, Ms. Gingras.
Okay. Thanks so much. I'm Karen Jangra. I'm the Executive Director at the Edmonton Community Development Company, and to my left is Anna Bubel. Anna was contracted to be our researcher and has written a report that was also submitted with our PowerPoint earlier in the week. The Edmonton Community Development Company evolved from the work of End Poverty Edmonton. We're anchoring investments in core neighborhoods to help the City of Edmonton and the residents of these communities in their revitalization efforts. In 2018, we started a database of problem properties that came to our attention from neighbors, from the AHS health orders online, and from driving around the neighborhoods. I think we're on slide 2, is that correct? Can we go back to slide 2, the thesis? All right, thank you. With the information we derived from the database, we launched Project 10, where we plan to purchase 10 derelict problem properties, tear them down, and build affordably priced homes for families to purchase. As our database grew, we learned about the history of the properties we purchased, and a thesis began formulating. With funding from the City of Edmonton, we were able to contract Another Way Consulting, Anna Bubel, to not only assist us with the myriad of complications that come with developing in core neighborhoods, but also to do this research for us. The thesis for our research was that there are extraordinary demands on governmental services, and as importantly, there is significant financial and emotional burdens for neighbors and communities. Next slide, please. So our context. We have 207 problem properties in our database, and we've learned the city has 480 properties in their database. And all of these are problem properties. These are more than just a neighbor calling and saying, we don't like the fact they didn't cut their lawn when we thought they should. Next slide, please. So our methodology, while the city wasn't able to share their database with us, we were able to get data on 14 properties with very high intensity demands on city services from across the city. And then we took from our database 9 known problem properties scattered across the inner city and a cluster of 8 problem properties concentrated on one block in Eastwood. Altogether, we examined 4 years' worth of data on 31 properties. We also spoke to neighbors of some of these properties so that we could have the opportunity to share their experiences, because these stories really help us understand the emotional and the financial toll people face when living next to a problem property. Next slide, please. So we've tracked projected impacts, and you can see the long list: demands on services, community impacts, and there are many, and many touch points, as you've already heard from the city's report on resulting from our problem properties. Next slide, please. So this is a picture of a property we purchased. We were all very, very happy. It had already burnt to the ground. It was a drug house. And it unfortunately burnt the neighbor's house down as well. And we thought, great, this sort of saves us some cash. We don't have to demolish it, we just have to haul away the junk. Well, as it turns out, that's one of the things about building in the inner city and demolishing in the inner city. We couldn't just do that, because we couldn't derive the content of asbestos, we actually had to do a wet demolition, and our costs for demolition almost doubled. Next slide, please. So we decided to take, in our research, an approach to monetization. Intuitively, we know there's got to be this cost. The question is, how much? What is this cost? How much does it cause us in taxes lost, in time and effort spent on this versus other things? So you'll see a picture up there that is actually one of the properties we purchased, and I'll give you a little story about that one in a minute. To be clear, we did not have the time or the money to conduct rigorous academic research. What we set out to do was provide credible and transparent story about the costs of problem properties. So the costs were supplied by risk. The direct costs where they were not available, we went online and found published studies, and we used those as proxies. And the community impacts we garnered from interviews with the neighbors. So this property that you'll see in the slide is next to a very, very lovely infill. And they were very concerned about this property still being there when they tried to sell their land. And thankfully, that property was gone by the time they were able to sell. And I see my red light blinking, so I think I'm out of time. Is that correct? One more minute?
I'm afraid you're out of time.
Yeah. There we go.
But there will likely be some questions for you.
Oh, perfect.
Maybe able to return to some of your other slides and that kind of a thing. I believe next we have Christy Morin, followed by Sasha Grasso. Please go ahead.
Good morning. Thanks so much, Councillor Cartmel. Hello, Mayor, and hello, all city councillors and administration. It's us again, back at your table. We've been doing this for such a long time, and it feels somewhat redundant, but I know that this time I have hope and trust that this is in the hands of the right council and our right mayor and our right administration. I want to begin my talk by talking about trauma. I used Dr. Google to find out what trauma is. Trauma is an emotional response to a terrible event, like an accident or natural disaster. Immediately after the event, shock and denial are typical. Longer-term reactions include unpredictable emotions, flashbacks, strained relationships, physical symptoms, headaches, etc. There are 3 types of trauma: acute, chronic, and complex. Acute trauma results from a single incident. Chronic trauma is repeated and prolonged, such as a domestic violence or abuse. Complex trauma is an exposure to varied and multiple traumatic events, often an evasive interpersonal nature. What we're talking about today with problem properties, the word problem seems very, very light compared to what the community of the Alberta Ave District and many different inner city core communities are experiencing, and also other communities in Edmonton. When there is a problem property, and as David spoke about, it being actually a massive crime piece that's happening with needles and weapons and shootings and fires, these are not light problems. These are absolute horrific problems that a community is living in. We have amazing people that live in the district, and you as city council and administration have poured millions of dollars into revitalization of these communities to try and find a way through this. These drug houses, these drug dens, these places of violence, abuse, and oppression continue to hit our city core communities. Our neighbors are exhausted. They do not know what to do anymore. And I have to say, as a resident of 28 years of being here, I don't know what to tell them anymore either. So this is a report that I appreciate that administration has created, and thank you to our councillor for bringing this forward and our mayor to say that this is a problem. This is not a problem, this is an illness in our city. The city will not be well until these drug houses and these crime and violent locations of interest to police and fire and EMS are destroyed. Trying to think that putting a coat of paint on one of these houses is going to actually build up the community is an absolute absurdity. Putting a coat of paint does not help anything to the community. We need to get to the source of the community problem, and that are the people that are holding title to these properties, that continue to think that having these places that are places that they will they receive rent and continue increasing their property value as inflation increases, is where we need to go. Because these people are no longer considered, in my mind, people that are upright, upstanding individuals. They are people that are oppressive and preying on a community. All I can say today is upon reading the evaluation, it's very nice to see an evaluation. What we need tonight and today is actually teeth to go after them. We have several examples in the MGA is built, commercial and residential we need to go after, not just residential. Commercial property owners are just as much at fault as their underbellies hanging onto these places that are fronts for crime. We also need to go after the residential property owners as well. And we need to have teeth, just like Winnipeg and Surrey went about doing this. We as community are ready to report whatever we need to do. You're going to hear from a group of residents that are amazing, that have done endless hours, hundreds and thousands of hours of reporting and trying to make the right call. What we need today is leadership to stand up and be able to say we are going to go after them and not be afraid. Because fear will stop us in our tracks. We need to have a legal department that will say, yes, we are going after these houses and these property owners. And I will back 100% that type of work and that kind of aggressive behavior that we need today in leadership. Thank you very much.
Thank you. Next we'll go to Sasha Grasso, followed by Eric Estrada.
Hello? Okay, so I just wanted to bring up two houses that we have in our area of Calder. So on March 28th, I had my windows blown out the previous night by a BB gun. It was done by the Oberg block, so I had reached out to the police. The police came. They had shot out 3 other vehicle windows that day. My biggest concern is if there were children there. It is a drug house. Okay. And every day, regardless if it's winter or summer, they always have people that are dropping off drugs or picking up. You have shady characters that are going between 118th Street from the Oberg block or up to the Dover on 120th Street. We don't feel safe in our community anymore. I don't feel safe letting my nieces go out in front of my house to even play anymore because of these people. A couple summers ago, we had I believe it was a sex offender against his own children, but nobody was notified about that either. I'm so nervous now. I'm so sorry. I hate talking in front of people. Okay. Sorry, so since the last 24 years since I lived there, I would say within the last 5 to 6 years, it's just gotten completely worse. There was last summer, I believe, that there was a dead body that was found there. It's getting to the point where it doesn't matter if we call the police, if you call 911, we have no help at all. The people that live beside the Oberg block have been trying to sell their house for the last 10 years. It's just sitting there. These people are scared of them. When they came to show me the video of when my window was shot out, they were shaking to the point where they actually walked from behind their house to come in front of my house, and then they followed their same way back. And we don't know what to do as a community anymore. If we just keep calling, we just don't feel like there's any help. I think I'm done now. Oh, I'm finished.
Okay, thank you. Thank you for your comments. Next, we'll go to Eric Estrada, followed by Cora Shaw.
Hi, everyone. My name is Eric Estrada. I am the treasurer of Alberta Avenue Community League as a volunteer position there. I would like to start by reading a part of a goodbye message from one of our Alberta Avenue neighbors. After living in the area for 3.5 years, I decided it was time to move. Love the area, its proximity to many great things, small businesses and restaurants. However, the crime in this area is insane. It is not bolted down or guarded by barbed wire. You are sure that it will be stolen, broken, or you will get your garage door kicked in. One of the final straws for me was finding a pile of human feces where with a used paper towel about behind my garage, right where one will step. Evidence of drug use and condoms with bags and clothes and garbage all around my parked vehicle behind my garage was also common occurrence. What is wrong with this city? Not sure why the area so well known for a problem area isn't patrolled more often in many other different ways. But I'm done. I move out of the city, not just the neighborhood, onto the greener pastures. I wish the neighbor well and hope things can change so people can feel safe again. And before I jump into what my thoughts are on the report, I want to speak a little bit about what do we mean by problem properties. We mean by problem properties used for illegal substance abuse, gangs, human trafficking, and some of these properties have years on cycles of heavy activity and a slowdown when the city sort of intervene. But keep on going without much being permanently done. Some of these properties run without water, electricity, and have people living in inhumane conditions. I read the problem properties initiative update, and the executive summary is short of telling council that the management is exhausting resources. The city management is exhausting resources on what seems to be a very costly whack-a-mole game, closing one property down only to see 3 more appear. From attachment 2, the metrics on problem properties in Edmonton, it is clear to me that there is no permanent solution to problem properties. In 2018, from 2018 to 2020, there was an increase in new problem properties and average closed file drops. I'm not too sure what do we mean by closing files. It is not surprising that by 2020, new properties submitted will decrease, but not because the effectiveness of the initiative, but because neighbors are exhausted of calling for help. What do we want? We want clear path to demolition of these problem properties that are preying on our most vulnerable neighbors. We want to know what does closing a file mean, because in the 311 app, we often see file already in investigations X months ago. Increasing taxes will actually make a difference in these problem properties if they're already not paying taxes. That's just a question that we have. How are these taxes increase going to improve the safety and well-being of our communities and not just get dispersed elsewhere? And do we really want to offer a grant to predator landlords to swipe away the fines and continue exploiting our most vulnerable neighbors? That's another question that I'd like the administration to answer for us here. That's all I have.
Thank you, Mr. Estrada. Next, we'll go to Cora Shaw, followed by Karina Hurtado.
Hi, is my mic on?
Yes, it is. Yeah, oh, there you are. Hi.
Oh, okay. I live in Alberta Avenue. I'm Cora Shaw. I've been involved in the revitalization for a real long time. And it seems like we've gone backwards in this community to where the point it's scary to be out in the yard at night. You know, I've had people threaten my dogs. It's just been a really difficult time the last few years. And my husband and I we're slowly but surely losing hope into what to do, because we call 211 to get help for people. they're so underfunded, they can't send anybody. And then they say, well, phone the police non-emergency line. Well, it happened to be on Saturday night, and the non-emergency line, I had an hour-long wait. By that time, the person was gone. The person was clearly out of their mind, and I couldn't get any help for us. And one of the problem properties we have on our block is a group home run by E4C. And I have pictures here of the garbage, of the needles, of the people sleeping in the driveway. We're beyond frustrated. We've got so much security cameras, it feels like we're living in a prison, as opposed to being able to live in our own home without worrying about gunshots and somebody's going to hurt our animals or whatever else is going to happen. My husband works nights. He's scared to leave me at home alone because I am disabled now, and I deal with a lot of physical issues right now, and I can't protect myself, and that scares the crap out of him, and it scares me. You know, we talk about trauma. Well, this is trauma. This is traumatizing to the people that are living with these properties. And I'm reasonably sure that people wouldn't allow it if they were in what's happening in their neighborhood. Yet it seems to be okay for our neighborhood to continually deal with this problem. And it's way beyond a problem right now. It's scary. People are moving. People are constantly posting about people breaking into their yard, breaking into their garage, breaking into their vehicles. And, you know, I know we keep saying, well, make sure everything's locked and all that, but there's only so much we can do to protect ourselves. I'm really hoping that this isn't more of the same that we've been getting over the last few years. I'm really hoping that we have an opportunity to help communities that are dealing with underlying issues. And I know a lot of it is addiction and mental health illness that needs to be dealt with. I just don't know if the city can do it. We need to have some buy-in from all of our governments, not just the city. And I'm not sure even where to go with that anymore. Basically, I'm here to just explain how I'm feeling, how my husband's feeling, and as you've probably heard, how the community is feeling. And we need help. I'm asking for help today. We need it. Thank you.
Thank you, Ms. Shaw. Next, we have Karina Hurtado, followed by Doug Paquette.
Good afternoon, Council, and thank you for the opportunity to speak this afternoon. I really, agree with all the comments on how we feel in our community, but I'm not going to talk about my story because I already shared my story of how I feel and what I have seen in the Alberta Avenue with the Police Commission. We have also shared our story, and we have given a tour to the chair of the Police Commission, who spent 4 hours with us touring our community and looking at the properties and the issues that we're facing with the stress residential and commercial properties in the Alberta Avenue and the Alberta District. So I want to speak about the urgency of the City of Edmonton doing and taking action in regards to the properties issue. I moved to Alberta Avenue 16 years ago. And since then, there's been many properties that haven't changed. It's the same, all order up properties, completely neglected, slum landlords. The level of crime that we are experiencing here, and lately since COVID, the number of arsons, the number of fires in abandoned, but also in garages that are like, well kept and people that take care of their properties that have also been affected. So they're not just problem properties. I would like to ask the city to look at different models that are working in terms of taking care of distressed properties across Canada. Last night, I spent a lot of time reviewing what the city of Surrey has done in terms of dealing with this type of problem. If you look at the distressed property program that they started in 2016 and the amazing outcomes that they have achieved to deal with the 94% reduction of problem properties in Surrey, I think that is a model that the city of Edmonton can use. I would like to encourage the city of Edmonton to maybe visit that city and see how that model has worked for them. When I read the report and I just listened to the presentation today, it seems like everything is working well. Like I've been here for 16 years and I haven't seen any change. In the contrary, I've seen an increasing decline on the abandoned properties that they're in this area. I think there's about over 250 properties in the Alberta Avenue, Macaulay, and Eastwood neighborhoods. 250. So that is, I think, too much for a community to deal with. We're reaching that tipping point where these problem properties are impacting our local economy. They're impacting neighborhood equalization, income equalization. We're seeing many of our neighbors that were like invested in living in this community, bringing their assets, their resources to make this change, leaving because they feel frustrated. We feel that we can't do anything else. We can't be social workers. We can't be police officers. We can't be counselors or trauma counselors. We don't know how to deal with neighborhood mental health. We don't know how to deal with, new supporting housing and shelters that are like placed in our community without any support. So I will really like to see that report that mentions and provides more information about the prototypes and models that have been working in Canada that could be applied to our neighborhood. I also would like to know and have more information about the people and the community members that were consulted for this report. When I think back, it's probably people that have been involved for so many years, over 40 years of work that probably were consulted at one point, but the current group of people working on this, us speaking today, have not been consulted. So it seems like the urgency or sense of urgency is not clear. We don't want 2, 3, 4, 5 years for this initiative to take action and for the city to do something about the problem. Thanks.
Thank you. Next is Doug Paquette, followed by Maggie Glasgow and Jane Sampson. Mr. Paquette.
Right. Can you hear me?
Yes, we can. Thank you.
Great, thank you. No, I'd just like to say, I'd like to thank all of my fellow community persons who pre-presented before me today. This is one of the reasons why we love the community that we live in. We've got people here that are truly committed. I mean, we're community and neighborhood builders. And we've dedicated ourselves and volunteered and invested ourselves into this community. And as Karina said, we're not EMTs, we're not trauma consultants, or we're not security for our family and taking them to the corner store. And we shouldn't be doing all of this, or 14-year-olds taking Noxalone training programs so that they can help the neighbors in the back alley. I mean, these are traumatic events that people are facing just being members of our community. And we do what we have to do, and we'll do it. But this is not the kind of living that we anticipated. We've participated in over 20 years of consultation surveys, community meetings. We've spoken to council, we've spoken to the police, been in our neighborhood for 16 years. And, there was some great traction, I think, when we first moved back in 2006. And then we just started to slowly see some deterioration. And I think we have to stop sweeping these issues under the carpet and taking these blights, if you will. If we look at a human body, this is maybe even cancerous zones, and it's happening in our communities. And as you know, if you have cancer in one part of your body, it's going to move to other parts of your body. So the city needs to be on guard for what's happening. And if it's happening here, it's going to happen in other areas. So if we don't take care of it now, it's going to happen in other communities. And then that's going to be an even larger issue. That's really all I have to say. I'm really happy that the report has come out. And I think we've got a ways to go, but I think you have a lot of committed people sitting around here. I'd like to thank Ashley as well for carrying the torch. It's time, and we need all of everyone's help in order to take care of this. I want my city to be the city that I think it should be. And having this kind of blight or poison is not going to be very fruitful for a welcoming city that we want to see in the future.
Thank you. Next we have Maggie Glasgow.
Yes, thank you very much for letting me speak. So I'm also not here to tell my story. I've already sent in an email. I've spoken at the police commission, but I am here to talk about certain points of the report that I saw. So one of them is just around community consultations. What does that mean? And then also the incentive grants, and then health and wellness of the community surrounding these properties. So some of the definitions I saw were community groups, community members, impacted communities, and neighbors. And so I'm not really clear what these mean. Who was consulted? Are community groups, does this mean community leagues, or is this, organizations that work in our neighborhoods? And then, they provide supports, but then at the end of the day, do they leave? They leave and we don't have any supports beyond that. And so the evenings and on the weekends, they're not here. When I talk about community, I mean actually the people that live in the neighborhood, the people that are impacted by these problem properties, whose decisions are impacted by these properties. So like, will I let my kids outside to play? No, there's an armored personnel vehicle down the way, smashing into a house. I'm not going to go outside for a walk. I'm not going to let my kids play. So we're the community, and it doesn't include organizations that work in our community. It doesn't include proprietors of businesses whose owners, they don't live here, and it's not operators of supportive housing either. I agree that their voices should be heard, but they are not community, and I think there needs to be a clear definition of who community is and who's being impacted daily by these problem properties. So I'm curious, it talks about the community being consulted and impacted communities and neighbors. I'd like to know who that is and a clear definition. And I'm being really picky about this because I want to make sure that the residents' voices are being heard and that external organizations are not speaking for us. We really need to be heard, and we are part of the solution. I think there's some amazing people here and that couldn't make it today that can really help support some of the solutions to the problem property issue. One thing I did see was the attachment 3, I think it was point 17, the citizens advisory component. I think that really needs to have stronger language around that, like an advisory board. And also something to consider is financial remuneration for those that actually participate in that. As so many people have spoken about, we volunteer our time, so many hours of volunteer time to solve some of these issues. And we're overloaded. We're responding to opioid overdoses in our back alleys, mental health crises, children running away from things that are happening in front of them. And so and even just like the decay that we deal with on a daily basis. We really should be part of the team and considered as part of the team. And one of my concerns about this advisory board is actually that we're actually heard, and that what we say is actually of value and incorporated into the decision making. So the other thing was the incentive grants. It talks about providing grants for remediation of these problem properties. Really, honestly, the people that own these properties, they're not community members. They're not living here. They don't care what happens to their houses. Why should they get a grant that will help them put paint on their houses or fix a window? Really, if taxation is part of this, why doesn't that money go towards community programs that help support the residents who are affected by these houses? Our experience is that these owners will take the money and do the bare minimum and then walk away with the rest of it. So they shouldn't be, benefiting from this. These houses, if you really want to support the community, tear these houses down, close them so that these owners don't open them again and allow this chaos to happen continually, time and time again. Our health and wellness and our safety is being affected severely. We were being traumatized by these houses. My kids can't go outside half the time because of these houses. So please help us. And please, if you want to come and have a tour, it's open. I'd be willing to take anybody on a tour of our neighborhood. Thank you.
Thank you. Next, we have Jane Sampson.
Good afternoon, everyone, and thank you, Mayor and Council, for adding me to the agenda and giving me an opportunity to speak. I have such wonderful neighbors who've offered you some of their experiences and some ideas around what we think our priorities are as we see them. This is a community in crisis. It's not just a problem, it's a crisis. Christy was absolutely right to speak of trauma. I've lived for 13 years on my block in Alberta Avenue. There have been 2 murders, 3 drug houses, constant police and fire involvement, 3 recent fires that I can think of, and the list goes on. So I'd like to speak to a specific aspect of the report, the pilot project of the Community Property Safety Team. The report has this pilot running for 90 days, which in my opinion is far, far too short a period of time to get to grips with the scale of the crisis in this neighborhood. And I noticed in the presentation that it's now 60 to 90 days, which is going entirely in the wrong direction, in my opinion. I would love to see a 2-year pilot project. And I would also love to see the members of that community safety team come and join us in the neighborhood, not just for a walk, although Maggie's quite right. A number of us would love to give you a tour, but come live with us for a while. Rent an office up on Alberta Avenue or on Norwood Boulevard, and have office hours that reflect the times of day and the days of the week that problems are the most active, evenings and weekends. Be a presence with us so that we can come and communicate more easily with representatives of this team, and so that the team itself has an opportunity to encounter the neighborhood in a richer way than can ever happen through surveys and studies or a quick in and out 60-day pilot project. A neighborhood in crisis needs much more substantial leadership than that. And the fact is, we have the tools. City has bylaws that, if they were aggressively and consistently enforced against problem landlords, my neighbors are right on in identifying that. This isn't about changing locks and fixing windows. The landlords who are collecting rent from these properties and playing host to gangs, for example, who in the last, 3 or 4 years, in my opinion, the presence of gangs and the immediacy of violence in the neighborhood has really escalated. I am so tired of every summer, every weekend, shots fired. And we all get on our messenger neighborhood message and we say, you know, are we going to even try to call this one in? What's going on now? It's become much more urgent and has reached the crisis level. So thank you very much for your work this far, but we're looking for this particular council. And I would also like to thank Councillor Salvador for her advocacy and for her listening. This is the time that we need council to step up and to give teeth and urgency to the tools we already have, to the multidisciplinary processes, the team approach that we know is the one that works. And to deliver that in a meaningful way, I think through an actual team office footprint in the community would be a great start. Thank you very much.
Thank you. We've had another person register to speak, so I'm going to move that we hear from Jessica Peverett. Please vote.
I can see that you're in, we have 5 votes.
Please display the vote. That's carried. So over to Jessica Peverett. You have 5 minutes for your presentation.
I can see that Jessica is on the line. She just may need to unmute.
Ms. Peverett? Okay, I'm not quite sure what to do here.
Oh, they have left the meet. I'm assuming they'll rejoin again. It seems we're having technical issues today.
Okay, we'll just wait another minute. Okay, well, maybe we'll see if Ms. Peverett can join us momentarily. In the meantime, then, why don't we go to questions of our guests? I will start with Councillor Tang. You selected this item, so we'll start with you.
Yeah, thank you everyone for coming out to speak, not just today, but for all the many times you have spoken on this over and over again. You know, certainly your stories are heard and acknowledged, and I'm very anxious to see some of the actions that will come out of today. I want to start with the ECDC team, the Edmonton Community Development Corporation. Just give you an opportunity to, I guess, touch on the research that you were talking about, and any highlights and recommendations specifically. I know, Karen, you didn't quite finish your presentation there. So either Ms. Gingras or Ms. Duval.
Thank you very much, Councillor Tang. We did a fair number of calculations to try and get some credible amounts of the cost to the city and to the residents for every single property. And one of the sets of data I found particularly interesting was the effect on suppressing development in a community. And so what we did was we looked at a derelict property. We looked at the assessment of that property over the 4 years. Then we looked at the 2 neighboring properties. And then we took a control property from outside of the that particular block, but of similar age, similar style. So we weren't, comparing apples and oranges. We tried to compare apples to apples. And we found, as you probably have seen, Councillor Tang, in the report, that the assessed property values went down over time to those neighbors. And as I had briefly mentioned in my presentation, the people in that very lovely $650,000 infill next to our derelict property that we eventually tore down were very concerned, wanted to know when this was coming down, how quickly could we get it demolished, because they were concerned about their ability to sell their property, not just what they could sell it at, but their ability to sell their property. I think that's something that is important for us to actually talk about.
Okay, thank you. So out of all that, did you have any, I guess, immediate actions? I mean, the administration report, there's quite a bit here, but I guess in your own research, are there any specific actions that you think this council should really prioritize right away that corroborated by your research that you did?
I think now actually is a good time to start doing things, but I think we also need to consider what our outcomes are. What is it we're seeking to do? Because I think there's been a lot of action taken and it's been redundant. So what is it we hope to accomplish? What do we need to do differently to accomplish those outcomes? And we are actually doing another research project funded by CMHC through the Housing Supply Challenge, which we hope we have an opportunity to present to Council and to this committee to give some actual much more detailed ideas of what you could actually do within the context of the existing legislation the city currently has, as others have already mentioned.
Great.
So,
thank you. In my last minute or so, I want to ask Ms. Morin, and I also heard Ms. Hurtado mentioning Surrey, 94% reduction. I guess I'm just wondering if you can expand on, what specifically did they do to get that number? And also you referenced Winnipeg example. What is it about the teeth that they had?
I'm going to pass this to Karina, Councillor.
Perfect.
Thank you, Councillor Karen, for your question. Well, last night when I was reviewing the distress property program that was developed by the city of Surrey, it was very interested in their approach. So they have an escalating security program where they work with community and they work with landlords to have to request the landlords to provide security to the private properties that they were in the neighborhood. So it started with, I think it was 3 or 4 hours it started with a camera system, and then with 3 or 4 hours of providing personal in-person security. And then if the number of complaints from community continue, they increase from 4 hours to 12 hours. And if the number of complaints continue, it went up to a 24-hour security, in-person security approach. From that, the city was able to, if they didn't comply, the city was able to demolish those properties and to end with the problem of impacting the community at large. They also have done studies on the number, on the cost for police, so inspections, fire, and bylaw. They have worked on those 3 fronts to help address the problem properties. They have a whole evaluation on the approach, and the outcomes that they have seen are amazing in terms of how effective this approach has been, with 94% 5% decline on the number of problem properties in Surrey. There is a link I can share with you. I think that model should be reviewed. It worked really well. I can share the link with.
Thank you so much. That would be great. I'm out of time. Sorry, Mr. Chair.
Thank you. We're going to go back to Jessica Peverett. Has she been able to join us?
They were on the line, but have since disappeared again. I did ask our office to reach out, but I have not heard back yet.
Okay.
Hello, can you hear me?
Is this Jessica?
This is Jessica.
Yeah, we can hear you. Please go ahead. You have 5
Sure.
minutes.
Thank you so much, and thank you for your patience as I had some technical issues. I just want to thank all the community members from the other streets and neighborhoods who are expressing some of the same challenges that we're facing here in Macaulay. It's been a difficult couple of years, and we know that there are some really strong systemic issues at play, given the opioid poisonings, poverty, COVID-related issues. But one of the things that we are trying to do in our neighborhood is really get together with our neighbors and find ways to help and assist. And the challenges that we are facing are basically running into roadblocks at every opportunity. We're working really hard with each other to notice issues, to notice problem properties, to notice changes in our neighborhoods. And when we approach all of the places that we think should help us, like 311, police non-emergency, scan, and we're told it's not a problem, go away, or it's not enough of a problem, come back later. It's really disheartening as community members to hear that, because we're the ones who are on the street all the time. It may not be that house has a criminal element that is, something that you can call into EPS and ask for support in that moment. There may not be a crime in progress right now, but I can tell you exactly what a drug house looks like as traffic increases, as people are hurt in and around the home. I can tell you what it looks like when a landlord is exploiting the people who live in that location. I mean, we have 3 houses on our block that were all active at the same time. We had one house that SWAT had been there 3 or 4 times. They'd taken over 100 people out of it in the 3 times they were present. And, it took us a really, really long time to be able to get any action from SCAN, and we were very lucky to have that action. They actually shut down the house for AHS violations, but we had 2 others on the street that were impossible. We had a confusing situation with one home in particular where the ownership was in question because the house had been foreclosed on, but the house was also being rented to members of Hells Angels. It was a very confusing process for us, and it was very difficult to get help. So I encourage during this process to really streamline your options for community members, because we need to know what we can do, who we should go to, and how we can access the best help for our neighborhood, because we're losing people left, right, and center. It's becoming difficult to enjoy our neighborhood in the way that it's meant to be enjoyed. It's not dignified for our community members and neighbors to be suffering on the streets and using those derelict properties as their temporary homes. Nobody is winning out of all of this. So I really encourage you to really think through the process and how community members can be involved.
Thank you. Thank you for your comments. We'll now go to Mayor Sohi for questions.
Thank you, Mr. Chair. To everyone else, to everyone that participating today, I just want to let you know that that we hear you, and we share your frustration, and we hear your call that you want City Council and City Administration to step up, and we will do what we can to work with you, tackle this problem. I know our administration has been doing that, but we need to absolutely do more. We hear that. And I do have some questions on, I'll start with the ECTC, about the capacity of your organization. I know you're working on 10 properties, right? If some reason another 10 come our way, right? I hope more than 10 come our way, because we want to probably demolish all 400 and 80 properties, right? So want to know your capacity to deliver.
Well, if we have the money, we can buy more properties. We can demolish more properties. So right now, we're actually using debt to do this through the Social Enterprise Fund at 5%. And thankfully, we have the Social Enterprise Fund because we'd never get funding otherwise, because we're not laundering money.
Okay, so that's okay.
That's a big deal.
Okay. And where are you on the 10 properties?
We've just purchased our 10th property.
Okay, got it. Okay. You know, in my view, we should have a zero tolerance for slum landlords. And we should do everything that we can to shut them down. I do have a motion that I will be making on behalf of Councillor Salvador and Councillor Knack, because they've been doing the heavy lifting on this, right? And one of the part of the motion is actually extending that proposed pilot from 60 days to 18 months. So maybe I'll go to Ms. Sampson for your, okay, well, you're already clapping, so that's, you gave you an answer on that. And also the, another component of the motion is the looking for different tax subclasses for residential property, and also exploring the option of looking to non-residential properties to be included in some sort of subclass. So want to get you, maybe I'll go to Ms. Moran for your thoughts on those.
I think it's fantastic. We talked as community the other day, and Councillor Salvador was at our table, and I think the 18 months, we talked about 24 months, we'll take 18 months, Mayor. I think that sounds fantastic. The subclasses, it's a great direction, and see where we can go with how heavy we can hit for what, you know, what types of negligence and problems that we're dealing with, for sure.
Okay, good. Now look forward to the outcome of these motions and continued work. But please do know that we take this seriously. Yeah, thank you.
Thank you.
Yeah.
Thank you. Councillor Salvador.
Thank you, Mr. Chair, and just echoing Mayor Sohi's gratitude for all of our speakers today. Thank you again for your continued advocacy, your emotional involvement in this as well. And I'm hopeful that we're going to be coming out of this with some solid action. So I want to start. I'll just go back to Ms. Moran, actually. I'm wondering if you can speak to the importance of, you mentioned not only the residential side, but the commercial side as well. The focus tends to be more on the residential side, but I know that you raised that as a concern.
Absolutely. Thank you, Councillor. Definitely the commercial corridor of 118th Ave, 112th Ave, any of those, 107, we're looking at many of those, definitely are a concern. We have many, many derelict buildings that are just sitting and decaying, and they are just not attracting any type of economy. If anything, it's the opposite of economy that they attract. And definitely, if we could actually start doing some taxation against those particular owners of those buildings, that would be fantastic. I'm thinking of a couple just in my mind right now, Councillor, that have been sitting for years. This is not a month's or a week's problem. They've been sitting for sometimes like 8 to 15, 18 years derelict. And our poor administrative team has to continue sending out bylaw officers to boarding them up again, which then again is just it's just the gerbil in the wheel.
Yeah, absolutely. And I know some of the properties you're referring to. And, it also ties into a larger conversation around revitalization. And, I think we so far have placed significant focus on revitalizing some of these communities, but I guess I worry that there's a slipping backwards effect if we don't address this swiftly. And you did mention the revitalization piece. Any additional thoughts on that?
100%. I mean, I've been part of revitalization since 2005. What our residents are now feeling and reacting to is the same amount, the same intensity, and the same density as what we had back 18 years ago. So yes, we are definitely moving backwards, and that was our greatest fear, is that we are going to start losing tread and start going backwards. So you're correct.
Okay, well, I appreciate that answer, and I want to jump to Mr. Estrada if he's still with us. And actually, maybe Ms. Glasgow, you mentioned it as well. Just some concern around any sort of granting program that would be attached to this. Mr. Estrada, are you with us?
Yes, I'm here.
Great, yeah. So just the concern around the grant piece. I know that that was presented in the report as a possible incentive, but you cautioned against that. Just understanding is it the property owners themselves that would be problematic in that sense?
Well, the problem property owners, in paper at least, right? The ones that are operating these problem properties, abusing our neighbors, that's the concern. We don't want to hand out money to drug dealers and gangs, right? If there is disrepair from a known neighbor that is taking care of their property, by all means, but administration need to consult with us, with the neighbors, making sure they're not funding a drug cartel.
Yeah, absolutely. And that was something I flagged as well. Ms. Glasgow, anything else on that?
Yeah, I think, just making sure that like a lot of these problem properties have been around for years, just as Ms. Morin was talking about. I think that, as Eric said, we really need to make sure the community is involved in figuring out which ones are the repeat offenders and making sure that those are the houses that get closed down, not fixed up. It's not fair to the community members who are trying to do their best in fixing up their houses. These people that have had this history of not contributing to the community get this benefit, whereas we don't. So it's a very complicated situation, and I think it could cause a lot of rifts in the community.
Yeah, absolutely. And just my last few seconds here, I wanted to go to Ms. Sampson. You've lived in the neighborhood a really long time. You spoke about the urgency of this issue. I'm wondering, when looking at the proposed community property safety team, you kind of spoke about the importance of being able to integrate that and have a direct line so that community members can actually help inform some of that work, help potentially identify properties that are problematic in the neighborhood. Did I catch that right? And I guess based on your reading of the community property safety team, do you feel like that could be a good mechanism to ensure that community is involved?
Yes, I think so. Given the success of the SCAN program, an integrated program which, when it works really well, but they're understaffed and it can take 6 months to get a property SCAN file number. So I know that this kind of approach can work. And what I was advocating for particularly was office space on Alberta Avenue or on Norwood Boulevard among some of those neglected commercial properties where the team would actually be part of the neighborhood, not just sort of driving in from a distance and then driving out again. I think it would be easier for neighbors to collaborate and for the team to get to grips with the situation.
Okay, well, I'm out of time, but I appreciate your answers and I'll come around for administrative questions. Thank you.
Thank you. Councillor Stevenson.
Yes, thanks very much, and thanks to all of our speakers today and for the other presentations that you've given in the past as well. Just wanted to ask Mr. Estrada briefly, you spoke about some of the work that the communities have, well, a lot of the work that the community is having to do in terms of reporting these. Just wondering as well, right now, what is your experience in terms of some of the follow-up? When you submit a complaint, is there sort of a process by which you hear the outcome?
Nope. That is part of what we're looking to understand a little bit more. We have transparent cities in paper, but we don't really hear anything back. As soon as we file in all this reporting, there is no way to access the information, at least not an easy way to access anything from none of those dashboards that are out there.
Right. Thank you for that. And, I might direct my next question to Ms. Shaw. I think if, just wondering, or just around this idea of how feedback is submitted, I heard that there is now anonymous reporting, but just wondering that, and actually anyone can answer this, but the importance of the potential of proactive investigation by the city or proactive work by the city to save the community members from even having to submit these complaints, if someone could speak to that.
I only am aware of 211 for calling when there's issues of a person that's in distress, but may not need a police car. It could be just that their mental health or other things along that line. Currently, I'm on a social network called Nextdoor, which is the app that we use for reporting safety and other concerns, as well as, you know, neighborhood parties or whatever. It's been used for both things. And I have found that that's been quite helpful in order to see what's happening in our community and even on my block. Because we've had quite a change. We have a liquor store now on one end of the street that we're on, and we have all this other stuff going on 111th Avenue. So it's kind of in a little bit of a rough area. But yeah, that's basically what we do. We just need some tools and to be able to, when we call 911, for instance, to have them show up.
A response.
It's crazy.
Yeah.
It's just,
No, thank you for that. And yeah, maybe Ms. Moore, and if you wanted to speak to that as well, just sort of the burden that's on the community to do the reporting.
Absolutely. The burden on the community is very, very heavy, Councillor. As you've heard, I mean, we do Cops at the Carrot, right? And there is never-ending stories about crisis and trauma. And that's why I started with the trauma comment. It's just extremely heavy and a huge burden. The lightness of being able to go to a park isn't there anymore. The lightness of being able to go down your street and have your kids ride their bikes isn't there anymore. And we've created magnets, we've created all these things that, you know, help us and support the community. But truly, it's community doing the work. And we really need the city to say, this is our work and we need you guys, but this isn't your job, this is our job.
Great, thank you so much for that. And finally, Ms. Gringas and Ms. Booble, as you wish. There's a tension that I want to speak about with you as well, just around the redevelopment of these properties, and it comes down to what replaces those homes, and I think there is a tension between, you know, the city's housing redevelopment program. It was required to be affordable housing to replace it. I think that the work that ECDC is doing is focused on market housing. And again, I just feel that there's a bit of a tension there in terms of the availability of accessible housing for folks who are experiencing low income or don't have access to a lot of housing options. So just wondering how your organization is working through that tension and the approach that you're taking to the type of housing that's replacing the derelict housing.
So the type of housing that we're building is market housing, or slightly below market rates. And we're building it in core neighborhoods. And I think that if we looked at the data, we would find an incredible density of supportive housing in Macaulay and Alberta Avenue District. And so I think that it is really important to distribute that burden, because that's what it is, and you've heard it, across other neighborhoods. And I think it's one thing to say, yep, we're going to build some more houses and put houseless people in these places, and then we forget they're humans, and they actually need some wraparound supports. So I'm really hoping that as the city considers providing supports for supportive housing and not just shelters, that they also consider the importance of providing that wraparound service. And Jasper Place Wellness Center holds that bar very, very high.
Great, thank you so much.
Thank you. I think that concludes questions then of our speakers. Just giving the technology a long time to work. So we thank all of you for coming and sharing your experiences with us today. Really appreciate your time and your patience as we've worked through this agenda item. We're now going to move to questions of administration, and I'll go to Mayor Sohi first. And I understand you have a motion, Mayor Sohi, so maybe we'll put that on the floor right away too.
Yeah, there's two motions. I'll put them all together, right? So, so that we can ask questions on that too. So I'll move that Community and Public Services Committee recommend to City Council, number one, that the Fire Rescue Services Branch Office of the City Manager 2022 operating budget be increased by up to $850,000 on a one-time basis, with the funding from the Edmonton Police Services funds held within financial strategies for the purpose of extending the Community Property Safety Team pilot for up to 18 months. And prepare an unfunded service package for consideration at the 2023-2026 budget. Number two, that the Community Standards and Neighborhood Branch Community Services 2022 operating budget be increased by $915,000 on a one-time basis, with one-time funding from the Edmonton Police Services funds held with financial strategies to enhance dedicated resources for problem properties as outlined in the April 11th, 2022 Community Services Report CS00896, and prepare an unfunded service package for consideration at the 2023-2026 budget. And the second motion is that the Community and Public Services Committee recommend to City Council.
I'm sorry, Mayor Sohi, to interrupt you, but I think we can only have one motion on the floor at a time.
Okay,
So we'll take them one at a time.
No worries.
Yeah. Well, if it's a part three, maybe you can, how about introducing this first? And if the other motion can be a part three to this motion, then maybe that's helpful.
Okay, in the meantime, I can ask city clerks in whether it should be part three or not. Right?
Sure, yeah.
Okay, good, okay. Quickly introducing this, Councillor Salvador has been doing all of the heavy lifting on this motion and working closely with my office, and Councillor Knack has been contributing this too, right? So I'm making this motion on Councillor Salvador's behalf as a champion of this very problematic issue that we need to tackle. So the first part is to extend that proposed pilot from 60 days to 18 months. That will give us enough time and also data and the success of that pilot that we can then look at extending that further as part of the budget discussions when we allocate our 4-year budget for 2023-2026. And the second part is to give additional resources to continue some of the work and the recommendations that are part of this report. I'll stop at here.
Thank you. We're still working on the other part of the motion, Mayor Sohi. So I'll go to questions from other councillors, starting with Councillor Tang.
Yeah, great. Thank you so much, Mr. Mayor, for putting this forward, and for Councillor Salvador and colleagues for all the work behind this. I do have quite a bit of questions, mostly for administration, but I guess I just want to touch on one thing. For that pilot being extended, so this is really focused around, being part of a pilot. I don't know if it's to Mr. Mayor or to Councillor Salvador, I don't know if it's possible for me to ask, but I guess to administration, is there opportunity for any kind of research opportunity through that pilot? I guess administration. If not, I will certainly love it to be, especially just thinking about Ms. Sampson's comment earlier about inviting this team to actually rent a room and live and observe. And in fact, I think that's a really important gap that I didn't actually see in this report, which is that ethnographic research that's needed to really generate solutions and actions. I think it's a fantastic idea, and certainly would like to see that as part of this opportunity.
Councillor Tang, I was struggling with my mic there for a second.
Okay.
I'm probably the best person to answer your question. One of the reasons the pilot wasn't very long was for exactly that reason. We had very limited resources, and we wanted to make sure that the work that we did was painstakingly documented to make sure that we knew if we were being successful. So the answer is absolutely, and some other areas of the city have already stepped on board to help us design some data systems to allow us to track exactly our successes, failures, and where we need to tweak the system. So I can confidently say yes, that is fully the intention of the CPST team, is to track all of our work. So in terms of a study, it's going to be a study in itself. So I can confidently say yes.
Okay, yeah, I'm really glad to hear that. And, certainly this kind of qualitative ethnographic approach is very resource and labor intensive, but I think yields perspectives and ideas that's, I think typical data is just not going to give us. I guess on the data front, do we have anything in terms of a problem property dashboard to track this with Open City?
My understanding that work is still in progress as part of the 7 recommendations or lines of business that we haven't finished yet, but perhaps Mr. Scott, I know you're on the line, if you could give us any update past what I just shared.
Yeah, Councillor Tang, we are creating those dashboards, and that was one of our key objectives, was to make sure we were able to put it on open data. Being cognizant of identifying problem properties and locations and that, but
Yeah.
certainly that is one of our goals that we'll endeavor to accomplish before the end of the year.
Yeah, and I imagine, I guess, co-designing that with community might yield some interesting ways to, share information, the interest of transparency, but also, respecting that the team's going to do what needs to be done. I guess one more question. This question actually came up with one of the speakers, but I actually had the same exact question. What does closing a file mean? And how are you working to ensure enforcement is working, like you don't have to keep going back?
Yeah, thanks for that question. Closing a file, and I reached out to the team just to get a good sense of what that meant. And in our lingo, closing a file means that each deficiency that's been noted in the inspections and re-inspections have been remedied. And it's not just from one organization, that's from all of the different agencies that are involved. Everybody has to be satisfied that those deficiencies are remedied, and then the file is closed and the property is moved into a kind of monitoring phase rather than an active investigation.
Okay, and so in doing that, you're not going back, and I guess that through that monitoring, you'll just make sure like you're not going back, and that's kind of part of the process. Is that how that works?
Yeah, I'm not sure if anybody from the team can join in about how the monitoring might be send a property into reactivation or not.
Yeah, Councillor Tang, it's Keith Scott again. So what happens is when a property is brought forward to the risk team, it's evaluated and it's prioritized based on the risk of the property. The team will then go out and do the investigations, and usually a number of orders and deficiencies and requirements are presented to the property owner. And remember that this type of work that the risk team is doing is focused on residential tenant occupied, right? It's not the vacant and derelict. So once all the deficiencies have been cleaned up, that reduces the risk of the property. It can be brought forward back again if the risk is increased, and usually it's by one of the teams where they say, listen, we're going back out to this property again. It seems to be coming up. We go back, do a risk assessment, and move forward from there.
Okay, great. Thank you so much. I'll come back.
Thank you. Councillor Rutherford.
Okay, thank you, Mr. Chair. I really appreciate, again, this motion being put on the floor. I have said to many that problem properties is probably one of my top 5 calls. So I want to highlight that this is, while we've heard a lot of speakers from sort of the downtown Métis area, this is definitely a problem throughout our city. One of the things that I have a question for administration is about a few of the files. I won't give any specifics, but that I've been having that I feel kind of are gapping in this current motion. We have one case in my ward, and you're probably very familiar with it, with a business that keeps operating without a proper business license, creating very intense disruption to neighboring residents, as well as even recently some anti-Semitic language being used by that business. But when I'm hearing about, the report that had the scale and it said the bylaw was reviewed that looked at escalating fines, but we're continuing to see that behavior. They've received fines and they're then still doing the action, like it's not serving as a deterrent? Or are we actually, like, how aggressively are we actually increasing those fines? And at what point does it get to the maximum? Just in general, not for that specific property.
Sure. Mr. Scott, do you want to weigh in on business licensing? Because I know that that's a little bit different than our problem properties for residential.
Yeah, certainly, Councillor Rutherford. If there is a business that is operating where there's
If it's a residential property in a residential area that's running a business, it shouldn't be running.
So that would be if they do have a home-based business. I think development compliance probably would be able to help me with answering this, but I'll take a stab at it, Councillor, that there is the opportunity to do a business license review. So if we are dealing with a problem property that has a business associated to it, we do have the ability to be able to bring that business license up for a review. And then the chief licensing officer has the ability to be able to revoke that license.
But they don't have a license. So do you see what I'm getting at here?
Yeah.
This property, this example, because everything I'm hearing sounds great. But what I have experienced and what my residents have experienced and the people that have connected with me is that that's not how it's happening in reality. And they're being told there's not really much that can be done. So this house, as an example, does not have a business license, was denied a business license, doesn't care, is continuing to run a business, is getting fines, and is still continuing to run a business. And the last conversation I had with administration was told that it was passive monitoring. We're really relying on residents to complain. We're not doing anything proactive. So I really am trying to get to the heart of this, because while I get that everything here is great and this motion is great, I'm not seeing some of those issues reflected in this motion. I'm trying to get at the heart of that so that we can really address all of those problem property concerns.
Councillor Rutherford, if I may, I think in the situation that you're referring to in terms of escalating fines, it's an opportunity for us to further collect evidence that we can then take that information to court. So I recognize that in that scenario, it may feel like that it's taking time, but it's also working through the different tools that we have, whether it's the Municipal Government Act or the business license, which they don't have a business license in the scenario you've suggested, but can certainly follow up with you more directly on this situation.
Well, and my question, I guess, to admin then specific to this motion is, does this motion as it reads right now cover that kind of scenario? Do you see a space in which we can have that dialogue within the context of this motion on the specific example of a scenario?
Potentially.
Yeah. What would you recommend as something to amend this motion to make it stronger and to capture that kind of problem property? Recognizing I get the difference between business and residential, and I know we're talking specifically about residential, but this is in a residential area. So I don't know if it's a gray zone, if that's the gap.
I think in the situation that you're referring to, it's wouldn't necessarily meet the definition of problem property in the scenario that this motion is looking to address.
Okay.
The situation is really around a use of a property where they don't have the appropriate entitlements and permits and business licenses. So that scenario doesn't necessarily fit the definition of problem properties in terms of what this motion is looking to address.
Okay, because in the report it does say land use infractions, property deterioration, unlicensed business operations, and or noise violations.
Thank you.
Right in the report.
Thank you. Councillor Salvador.
Thank you, Mr. Chair. And I'm going to go down a few different threads here. So I would just appreciate patience of colleagues, but I'm going to start with just the need for coordination. I think just looking around this virtual room, there's a lot of folks around this table, and I think about community standards, safety codes, fire, social development, HS, EPS, community, and where can that coordination happen? I look at part 2 of this motion, and I just want to make sure that sort of centralized coordinating hub piece is present. Does part 2 of this motion provide that?
That's our understanding of the intent, yes. And that's a missing piece for us right now because we do have lots of people operating off the side of a desk and with different portfolios. So this would help us accomplish that centralized coordination.
Okay, great. Thank you for the clarity. I also just want to build off of one of the other questions that was raised around, the monitoring piece, making sure that the outcomes we want to see are actually being tracked. So if we're looking at an extension of the pilot for the community property safety team, at the end of those 18 months, what are we expecting to see? Are we going to be able to point towards X number of properties secured, potentially demolitions, et cetera? Will we be tracking those types of criteria and metrics?
Thank Councillor for the question. Absolutely. What's different about the CPST team approach, and just to clear up, I believe it was Karina Hurtado asked why aren't we trying the Surrey model here? Just so everyone knows, the CPST is Edmonton's version of the Surrey model. It's very much based on it, in fact, using our own local laws, which are very similar. The intent is to once you become part of our system, you never leave it. There is no clock, there is no timer. It's an escalating enforcement model so that once a property is actioned, if it fails 2 years later, you go to the next step. You don't go back to square one, and that is one of the innovative pieces of it. So the monitoring, though, and this is an exciting part, I think, is we want the community to help us. We can't have enough folks to go out and check every property every day, but we've got a community of people that care, and we want them to be a big part of helping us know when we need to do more work. Yes, absolutely, once you become part of it, you're a part of it forever. And it's not just residential. I want to make that clear as well. The CPST team can deal with commercial buildings too.
Great, thank you for that. And that's exactly where I was going to go next. I just also want to make it clear that this essentially is the Surrey model that has seen so much success applied in an Edmonton specific context. Can you talk a little bit about the composition of the community property safety team? And I guess who would be involved in that team? What does that look like?
I can. We started in January and we repurposed staff to do this. And Chief Satili and I knew we had a serious fire problem. We had we had fatalities. So we needed to get to work. The magic of this, if there's a magic bullet, is there's a very simple and elegant line in the fire code that says vacant properties shall be secured against unlawful entry. That simple line is what made the Surrey model so effective, and that's what we want to use here. So we have to marry the fire code enforcement, which is done by fire safety codes officers employed by FRS, with the powers of the MGA, that allows us to do is to action a property. We want owners to do it before we come. That would be the best outcome. If they don't, though, we're going to secure them and they'll be billed for the work. So the team currently consists of 2 repurposed FTEs away from work that is also very important. It just wasn't as important as this work at the time. So we got started. That's why the pilot literally started this morning. So it's 2 FTEs. They're doing all their own admin work. They're very keen and very dedicated, but it's a very small group. Our ask is to backfill them so that we can still do the other safety work they were doing and make sure it continues. When we come with the 23 to 26, if the motion is passed, unfunded service package, council can help us decide how quickly we want to go after this problem. It'll be limited by human resources almost completely. So that's the story of who it is and who does that work, and those folks report up a chain through myself to the fire chief.
Great, I'll come around again. Thank you.
Thank you. Councillor Stevenson.
It's quite all right. Thank you very much. And as my colleagues mentioned, I will probably have a few rounds as well, so patience is appreciated. But I did want to say as well, I really appreciated the report. I appreciate the focus that's being given to this in administration. And my questions come from an understanding of the lack of resources that the teams have had as well. So please don't take my questions as critiques of the work, recognizing that I don't think we've properly funded enforcement. But I did want to go a bit more into what closing a file means, because I think what I heard from communities that I represent is that burden of reporting and follow-up, and that it is very much whack-a-mole, even on a specific property. So there might be some noxious weeds, the noxious weeds get dealt with, but there's still an overall problem on the site. So just wondering if there's some strategies or approaches that, I appreciate what this idea of the Surrey model with sort of it never being closed in some ways, that it's always there, but just wondering if there's almost like a checkpoint progression. So an immediate issue has been addressed, but that doesn't mean we walk away from the file. We're going to the next step, which is, trying to, fine it, or, trying to create ways where the city can assume more control or address the situation. So just some thoughts around that.
Sure, I may ask either Mr. Scott or Mr. Lallemand to speak to the progression that's being asked.
Yeah, I could jump in, and then Mr. Lallemand and Justin can follow up. One of the key things that we've been working on for a while is sort of that definition of the problem property. So, I want to get away from just having weeds on the property. I mean, that's not a problem property. However, one of the key things about closing the file that you mentioned initially, Councillor Stevenson, was it's closing the file from being on the list of the properties that we are sending numerous stakeholders and agencies to deal with. Once it comes off that list, by the individual agencies. So for instance, if there's a problem property that is, having lots of weeds, snow on walk complaints, what that generally does is it then passes it down to community. You would do continuous follow-ups, and the more times we go there and write a fine and then send an order and clean it up and place it on the tax roll, that's an opportunity for us to continually address that. However, that takes resources because it's a lot of proactive work compared to the thousands and thousands of complaints that we get across the city to deal with snow on walk and weeds and nuisance property conditions. Mm-hmm. So hopefully that answers a little bit of that question. Justin, did I miss anything else?
Sure, good afternoon. One thing that I would touch on is that I think what you're asking is, how do we don't just close it and let it go away. We do a holistic view, which means we're making sure that it's not just the weeds are cleaned up and then we close the file. And what we do is we bring these files back to the risk team table for review annually, or we can bring it up to our team and say, has anybody had any contact here? We're also working on a demand-based data tool that's looking to capture fire calls, police calls, calls from all sorts of agencies where we can potentially hotspot. We only know what we know, and these calls that are occurring in the police service or the fire department, they might be saying, hey, this spot's heating up, and what you should do is proactively send your team here and kind of see what's going on. And what we can do is cross-reference any previous problem property files that were there and maybe do a check-in, a door knock, and see if we can go there. So the idea is that we may close it because our files are closed, but we're not going to let it slip from our knowledge base there.
Yeah, thank you. And I think that's kind of what I mean by the checkpoint. So it could be that an individual file is kind of closed, but the property isn't off the radar, I suppose. And just wondering as well if part 2 of this motion will provide you with the resources to be reporting back to the community members as well. So if someone submitted the complaint, does part of that file close out have a report back to that individual as well?
Sorry, I would comment again that, right now what we have is we have our anonymous email, that's confidential reporting. We also have our 3-in-1 system. We've got dedicated officers that operate within the core communities of the district that contain the most problem properties. They're trying to hand out their business cards as often as they can. They're trying to attend community league meetings. We're trying to get direct feedback to the community, and we're always available to provide a file update. Whenever a file is submitted to our anonymous email, we have, if the folks provide us with, sometimes they provide us with their phone number, they want to be contacted. Sometimes they don't, we will send them an update as well. So yeah, the part 2 of the motion allows us to centralize the intake, provide feedback, and make it really clear who's doing this work. And if folks want to reach out, we're always available to chat.
Thank you. Starting the second round, Councillor Tang.
Thank you, Mr. Chair. I'm cognizant Dr. Sikora is online. Are you still online? Okay.
Yeah.
Oh, great. And the report said that, the city is engaging EPS and AHS for this. I guess, how is that going? And are there any, key themes and input that you'd like to just contribute here to the conversation?
So certainly one of the approaches that we're really reassured to see is that this is taking a social determinants of health approach. So housing is one of those critical factors for individuals to be successful in life, and this is a good thing. Ultimately, being able to improve health within community settings themselves, quickly actually address what those needs are around housing themselves. There's something that's actually been very efficient to be able to work through. Certainly our environmental public health team has had dedicated resource to work with the city and the safety codes officers and the EFRS teams to be able to go out, undertake these inspections, and that relationship has been very good overall to be able to get, again, decrease that amount of time to be able to get the inspections undertaken and to be able to get a clear path to getting some of these properties either back on the rails or actually get some pathway to a resolution.
Yeah, no, that's great. And can you just, sorry, not you, Dr. Sikora, Mr. Jones, can you just remind me if there is a AHS member on the property safety team pilot? Is this a cross-jurisdictional thing or?
I'll pass that off to my counterpart from fire.
Okay.
No, there isn't an AHS member serving, but we would certainly welcome their involvement to a degree. I mean, it is fire code enforcement at the end of the day, and ideally, most of the time, we're dealing with properties that don't have people in them.
True. So yes. Okay. Fair enough.
And Councillor Tang, it's Keith Scott. There is an AHS representative as part of the risk team. So they are actively involved with us as we're going on dealing with residential and tenant occupied buildings.
Right. And on the motion that's coming back in May for the community wellbeing and safety funding, is there a component of problem property as part of the overall community wellbeing and safety strategy?
Yes, the problem property initiative has been listed in that greater body of work.
Great. And do you have a sense of what is the financial savings on healthcare and criminal justice from working on dedicating some resources like we're doing with these motions?
Well, there's certain findings in the Edmonton CDC report that they brought earlier today, but I think there's sort of an unknown in how much there might be in savings just because of how intertwined and vast this work is. Yeah.
Yeah, but I think it'll be totally directly tied to the community wellbeing and safety. Thank you very much. Back to you, Mr. Chair.
Thank you. Councillor Rutherford.
I removed myself from the list.
Oh, okay. Thank you. I have you on my list. I tend not to watch that list. Councillor Salvador.
Thank you. Yeah, I want to talk a little bit more around prioritization and also just conception of problem properties and what that means. Because oftentimes I find that the spectrum can be quite wide. You know, we talk about properties that potentially have overgrown lawn or some shabby siding. But what we heard this morning from community members is obviously much more intense. And when it comes to the community property safety team, are there already properties that have been identified as like high risk, they're ready to go, we need to address these now? How is that prioritization going to work?
Thanks for the question, Councillor. We had a pretty easy target to start with. We had 136 individual fire events in 8 months last year in vacant properties. We intentionally started the pilot centered around Alberta Avenue so that we could keep very close tabs on our progress. And frankly, that's where a lot of the properties exist. So we had a ripe list ready to go. We also liaised and talked to the risk folks to see what properties they had been struggling with over the years. But there are, the prioritization wise, we wanted to be, well, frankly, somewhat agnostic. If a property is unsecured and vacant, it's in contravention of the fire code. So we would certainly take calls from the public. And if we will, is part of the pilot is to get our 311 scripts ready. And they're almost there, but they're not quite there yet, which is why we haven't gone public. We don't have a way to deal with that part yet. But in terms of triaging, if they're currently unsecured and if they've had fires in the past, that's our #1 hit list. Because those properties tend to have multiple fires in them, commercial or residential. So that's our #1 priority. But all vacant unsecured properties would be part of the list, and we'd like to action them as quickly as possible. We have a vision a year or two from now, because this problem's not going away in a week or a month, that in a reasonable period of time, if 311 gets a call, I'd like to set a service standard that the CPST identifies the property as a can or not within a time frame. But that's, of course, going to take resources and some time to develop. But that's our current prioritization method.
Okay, thank you for that, and that makes sense in terms of triaging as well. Maybe to Mr. Jones, I'm wondering, I really found the case studies to be quite valuable as the attachment in the reports that actually applied some dollar figures around the real costs associated with these properties. And looking at just the kind of 31 properties at close to, it was just over $1 million based on your adjustment at the beginning of the presentation. Do we have an idea if we were to extrapolate that in terms of where that number lies, just given the number of these properties we have in our city? Because it's just a significant cost, I would assume. I'm trying to understand where that would lie.
It is a significant cost. I think something to consider is the 31 properties that were used, or at least the 14 that we put forward from the risk team. Those were sort of considered the highest flyers, and so I would hesitate to say that we could just take the number per house and extrapolate it based on how many problem properties we have identified. But certainly, even if we mitigated that somewhat, it's still a fairly significant cost for lots of our different budgets.
Right. Thank you. I'm out of time.
Thank you. Councillor Stevenson.
Thank you. So just moving back to this question of point 2 around the idea of sort of more proactive inspections rather than relying on the complaint base, is that what we'll see in the unfunded service package, or is there a possibility of sort of having a reactive and proactive budget approach?
I think thanks for your question. I think the proactive piece would be in the coordination. But also, Mr. Lallemond earlier spoke about the way that we're managing our data and doing data analytics. And what we're really trying to do is push out whether we can be proactive in that way. If we can come up with some sort of early warning system to suggest, I know some of our community members said, these things spread. And really looking for sort of our current houses, our current problem properties, what their trajectories were into being problem properties, if there's some similarities, and then look at whether we can proactively identify some of those so we're not as reliant on, the good nature of the neighbors and residents who haven't become tired of calling in yet.
Thank you. I just want to dig into some of our other bylaw tools, and particularly the community standards bylaw, and sort of following from Councillor Rutherford's question of how aggressive we're being. So I understand, so I'm thinking, for example, of a specific site that was, there was a fire on site and a bunch of the debris has remained. So I don't think it's a structural risk from a fire safety perspective. The building it's only debris left. But it's an incredibly unsightly property, and it's causing a lot of concern for residents and businesses. So my reading of the community standards bylaw is that it is an offense to have a site that looks that way, and that it seems that we have the ability under the bylaw to fine them $1,000 for each day that they continue to be guilty of that offense. Just wondering if you could speak to the efficacy of that approach in terms of just a daily fine for every day that offense continues, and just again how we can be. I think I heard the community ask for more teeth, so just wondering how we achieve that.
Thanks for your question. I may put that one to Ms. Ash, if you're on the line, just to speak to the legalities of it.
Yeah, sure. Thanks for the question, Councillor. Yes, we can do repeated fines for a property such as that. Is that your question? Sorry, or are you looking to see how we could escalate that enforcement?
Yeah, so just wondering if that is our current practice, if that would be, if there's a belief that would be an effective way moving forward.
So from a legal perspective, I can tell you that's possible. I'm going to maybe refer that to Mr. Scott to talk about if that's actually our current practice.
Yeah, Councillor, it's not. I mean, we can use it. It's just a fine line between issuing multiple fines, tying up the court system, and whether or not that truly acts as a deterrent. We have in the past issued multiple fines. We've also issued a mandatory court requirement or mandatory court appearances. What that does is it allows us to go to court to say, okay, we've issued 2 fines at $1,000. Enough is enough. We want a $4,000 fine, and allow the courts to be able to provide us with sort of some of that escalating process.
I'll come back again. Thank you.
Okay, Councillor Knack is only on to speak. Do we still have, okay, we got rounds of questions. Okay, I'll go then to, I guess, Councillor Rutherford on the second round.
Yeah, I guess I just want to just tag team with Councillor Stevenson on that question, because my second round of questioning was going to be about those kind of properties where there's been a fire, now there's a whole bunch of debris, it's unsightly, and I've heard from residents in my ward that there's been at least 2 known sites in my ward that have been in that state for over 2 years. So I'm just trying to get a sense of what is the actual practice? And yeah, what is the actual practice, and what is the outcome? Because it's great that we have a report that talks about all these actions that we've taken, which are outputs, but we need to think about, are we getting the outcomes out of these that we're desiring? So I'm just trying to get a sense of that.
Thanks. Sorry, I don't know who was speaking there, but I can comment from a bylaw perspective. I'd say one of the tricky things is sometimes the fire investigation. So we often have to let there be a little bit of time before we can move in there and escalate our enforcement. But as I don't know these specific examples, but we definitely have the tools to deal with this. We have a escalated enforcement model that begins with compliance before enforcement. But when we have a history of repeat offenses or a lack of compliance, we can escalate tickets, we can issue mandatory court appearances, we can issue Municipal Government Act orders to clean those sites. And when the landowners don't comply, we can do that work and bill the cost to the property owner. And if they don't pay those bills, then we can add the cost to the tax roll. So there are mechanisms, and we have a model in place to deal with that.
And if I could add, Justin, we've got 2 things we're talking about. When a property has had a fire, there are certain mechanisms under the Safety Codes Act that must be adhered to. They're not usually long-term, but what more often than not it turns into is an insurance claim. And those can be very long-term, as we all know. In terms of the event being a fire, if the issue is safety because of the fire, then our staff and our safety codes officers would deal with that. If the aftermath is unsightly, then that certainly isn't within fire's jurisdiction to do anything about it, and it becomes part of Mr. Scott and Mr. Lelleman's wheelhouse. So
I'm definitely looking from the enforcement side. I mean, I think there's just examples of these, and maybe it doesn't fit into the, extreme problem properties, but I think there's a spectrum that we're missing in this motion that I'm contemplating what that means for future motions. Because even I think about, in Inglewood here, there's an apartment that was started to be built. The developer lost funding. It's now sitting there as a big empty pit with no fence around it and open rebar, right? So it probably doesn't fall into this definition, and it's still a problem. So I'm out of time. Thank you so much for those answers.
Thank you. That takes us to our recess. We have a couple more rounds of questions. We have another set of motions on this item. We have a set of motions on 6.2. And we have item 6.3 that we haven't touched yet. I was really hoping that we could deal with all these matters today and not deal with them at council and start to break that cycle of doing committee work at council. So hoping that we can try to get through to the end by 5. See you at 3:45. We are now starting the third round. Councillor Salvador.
I'm ready to speak, Mr. Chair.
Okay. That takes us into Councillor Stevenson.
I'll be very brief. So 3 questions in 3 minutes. I just want to dig into the business license being used as a tool. It's really exciting that is being used a bit more. But wondering if that applies just to commercial properties, or if we're also using that using that with landlords, and if it's still site by site, or if we're taking an approach where if a specific landlord owns multiple properties, that their business license could be revoked for all of the properties that they have.
Councillor, currently for long-term rental operators that are renting out 3 units or more, do require a business license.
But sorry, for each individual property, or like a general contractor who has a sort of non-geographically tied? And I ask because it creates the effort if we have to revoke the business license for every individual property versus a global business license held by an individual.
Understood. I'm going to pass it to Ms. Peter to provide some property-specific approach to our business license.
Hi. In terms of the business license, the business license renewal would be related to the specific property in question. If there was a history of concern with the individual property owner, then that would require additional property-specific requests to come through for the review.
Great.
Is
That's perfect. Do we have the legal mechanisms to take the alternate approach to license by landlord rather than property?
I'm not sure. I would lean on a legal colleague for that.
Okay.
Councillor Stevenson, I can answer that for you. At this time, the way the bylaw is drafted is property specific, not on a holistic. If what you're asking is, could we just go after one landlord for a number of businesses? It's not currently drafted in that fashion.
And is that something that could potentially be considered with future work, just in terms of that expediency, recognizing that we know there are patterns in terms of who these owners are?
We'd have to give that some thought. Legally, the way that we regulate the business licenses, it's very much individual business focused. So we'd have to give that some thought as to whether or not there's any challenges to take that kind of approach.
Sure, and I'm thinking of this, I believe a similar approach was taken in terms of general contractors in infill, in terms of those not being property specific, but rather contractor specific, but I'll leave it there. Just a very last question around the redevelopment grant. I believe that there were some challenges in terms of how that grant was structured, particularly around it only covering construction rather than full capital costs, so it didn't account for the higher acquisition costs of some of the most problematic properties. So just wondering, the report speaks to canceling that. Just wondering if there will be work to maybe reconfigure a similar redevelopment grant, because I think that there were some positive opportunities in that. Maybe someone from housing?
I'm not hearing a response, Councillor Stevenson, so that's something you can ask offline, or?
Yeah, I mean, it would have resource implications, but I can follow up and maybe we can touch on that very briefly when it's at council.
And Councillor, I can have somebody from social development follow up with you.
Thank you. Thanks so much.
Maybe we can have someone circle back to this meeting if that's at all possible. I really want to try to not repeat conversations at council because our calendar time is burning away at a furious rate.
Will do.
Yeah,
I'll get on that.
Thank you. So Councillor Stevenson, if maybe what we'll do is we'll just see if we can get an answer to that before we go to speaking to this motion.
Absolutely, and I believe there'll be another motion around taxation, so that
Yeah,
could
so
come up as part of it.
Yeah, so I'm not sure if I'm going to suggest that we postpone this item for the moment, this motion for the moment, and go to Councillor Sohi's next motion and ask you that he make that.
Sure, absolutely. Okay, let me find it here. Okay. that Community and Public Services Committee recommended to Council that administration provide the following to committee. Number one, options for definitions of derelict residential and non-residential properties for the purposes of creating tax subclasses, including number A, a discussion of tax rate differentials for a derelict property subclasses, including the maximum allowable rate ratio associated with the derelict non-residential tax subclass. B, details of an offsetting grant program, along with the draft policy that could further incentivize redevelopment of derelict properties. And this is C, methodology for monitoring and proving that derelict non-residential properties are unoccupied for at least 1 year to ensure compliance with Edmonton City Charter 2018 regulation. And the second part of that motion is that an approach for increasing the demolition and or disposition of problem properties, including but not limited to increased acquisition of properties through tax forfeiture. So it's basically, when we look at the report, can I introduce, sorry?
Yeah, yes, please.
When we look at the report on the residential subclasses, there is some under MGA, there's a strong understanding that we have the ability to do that. So this asks to pursue that. And second one is on non-residential, there's a little bit lack of clarity, not as much clarity because it is under the charter regulation. So, but we need to make sure that we are exploring that option, and so that is the intent of the motion.
Great, thank you, Mayor Sohi. We'll go to questions of the mover and of administration. I'm not seeing any from committee members. So, okay, there we go. So, Councillor Wright.
Hi, thank you very much. I just, in regards to creating the subclasses and increasing the amount that is assessed to these properties. In attachment 4, you've updated the uncollected taxes to be $249,000. That's just on the 31 properties that's in the attachment, right?
Hello, Councillor Wright. Yes, that is correct. It's not current of today, but current of the report writing.
Okay, and so I think we've got identified like 485 properties altogether that are problem properties. How many of those are in arrears? And what would be that total?
We haven't done that calculation. I would say that these are the most egregious. So I would suggest that it would be less than, but we don't have the number right now. We can certainly get that for you though.
Okay, and then how many years arrears are these 31 properties, and if you've got that information available?
This is the cumulative total of the 3 years that we studied. When we look at these properties, they are not consistently in arrears. They are sort of sporadic. They are sometimes in arrears, then they often pay off their outstanding debt, and they become in arrears again. So it's really a sort of tapestry of different tax histories that we have here.
So it's not necessarily that they're all up for the tax sale auction if they're paying it off periodically?
That's correct. The tax sale is a very legislated process. And so it requires the property to be in arrears for 2 years before it actually goes to a tax sale. So some of these properties certainly have gone to tax sale, but not all.
So if they are assessed at a higher rate, at least, and if they're paying it off every couple of years, at least we would be able to get some benefit of it at the higher tax rate?
Yeah, to be clear, they're not assessed higher. They must be assessed still at market value, but we do have the ability, council has the ability to set a subclass on the residential side that can set the tax rate to be higher And that would mean that, yes, if they continue to pay their taxes, penalties, arrears, that would generate revenue for the city.
Okay, but it still won't solve the problem of the derelict properties. Okay. But that might prove to be a disincentive for people to maintain their properties, correct? If they were going to be charged a higher rate?
Yeah, I would suggest that if there was an incentive, it would be to not fall into a derelict status, so that you would continue to be taxed at the lower residential rate and not the derelict rate, if we were to call it something like that. Okay. So there would be an incentive to keep the properties off that list.
Okay, excellent. Thank you very much. That's all I have for now.
Thank you. Councillor Tang.
Thank you, Mr. Chair, and thank you, Mr. Mayor and Councillor Salvador, for bringing this third piece forward. I guess I'm just reflecting on, and I recognize, Ms. Watt, you're talking, it's a patchwork, and some people are better at paying than others in one year over another, and there's a lot of inconsistency. But I am a little bit cognizant of the comment from one of the speakers. What is the point of working on this piece, this tool, this taxation tool, if we're talking about people who are not very diligent about their tax payment to begin with. I guess I'm just wondering, how do you, do you have a response to that? Is there some truth in that?
I'll be frank, I didn't quite understand the speaker's question,
Okay.
or the point that they were trying to make. I think they may have been speaking about one thing that was offered up in the report as an idea, which is we would consider taxing these properties at a higher tax rate, take the delta, so take the differential, and put that aside to sort of grant back if the properties were brought up to satisfactory condition. To be clear, that is not something we're obliged to do in any way. It's an idea. What council has the ability to do on the residential side is to create a subclass, to put derelict properties into that subclass, and then to tax them at, well, basically at any rate they choose.
Mm-hmm. That's no, that's great to clarify. I don't know if this speaker is listening, but hopefully that clarifies some of their that piece. And I guess in your inventory of taxes in arrear and late payments and et cetera, among this group that we're talking about in terms of derelict properties, do you have a sense that there are property owners who are more capable of others to absorb this cost, whereas others are in genuine trouble? I guess I'm just wondering about sort of the unintended consequence, and just to make sure that we've like considered that at the very least if we're moving in this direction.
I would say, listening to my colleagues, that the problem sounds to me as a layperson in this space that is beyond what I see on the taxation side. Certainly some of these properties are in arrears. Is that the nexus of their issue? It really doesn't appear to be that. There is these tools that are available to council within the Municipal Government Act and the City Charter that we could explore as a method of addressing. Whether taxes are sort of fundamentally the issue here, I would question that, I would say.
Yeah, no, fair enough. And I think this whole conversation hasn't just been about one tool, that this is one of many, and that's what we need. Yeah, I guess also thinking about if we create this and charge the rate however we like, if there are renters, albeit poor conditions, would that be passed on to them? And just want to make sure, I want to be able to flag that as well.
I understand. I would say to that is not something that we have sort of legal authority in. What landlords do is somewhat up to them in this province.
Yeah. Okay, thank you.
Thank you. Councillor Stevenson.
Thanks very much. I really appreciate the movers for bringing this forward. I think it's an excellent strategy, and I just so fully support adding a derelict property tax subclass. There are two things I want to get clarity on, though. I have grave concerns about the grant program. I worry that it creates an incentive for property owners to allow their property to fall into derelict conditions, or at best doesn't provide an incentive against falling into dereliction. So just wondering if administration could maybe speak to the recommendation of why that was brought forward and what risks you feel that might mitigate.
I will start, and then I may ask my colleagues to weigh in with any thoughts they have. The idea behind the proposal, I believe, is we would take the differential. So for example, our current tax rate is 0.7%. If we were to suggest taxing derelict properties at say 10%, that is so far over and above, it may look like we were sort of taking a money grab, so to speak. But if we were to take that differential and put it aside to say, if this property improved, if this property met community standards, if this property was no longer on a derelict list or a blighted list, then that difference could be reimbursed. And again, that is not something that council has to do. It's an idea of an incentive to move a property from a derelict status to an improved or the community standard. But I might ask my friends in community services to weigh in.
Yeah, thanks, Kate. Yeah, Councillor Stevenson, that was, I mean, Kate articulated that very, very well. It was an idea that was tossed around about saying, listen, this is not about money. Our whole philosophy is to get compliance. And so, if they are taxed and there's a penalization of the taxes for them, if we could provide a bit of a grant or something to give back to get them to change the property without us as the city having to take it on, that is what we're looking for. And so that was the idea. And certainly, as Kate has indicated, it's just something that we wanted to be able to explore and see if that was an alternative to just raising the tax and leaving it there.
Okay, and I really appreciate that explanation. And just for my clarity, when Ms. Watt, when you mentioned sort of the risk of it appearing as a money grab, is that a legislative risk? Like, would that could someone challenge the tax rate differential on that basis?
Yeah, that is a really interesting question, Councillor, and thank you for posing it. It's something that I have been sort of chatting to legal services about. So I might ask Cameron Ashmore to weigh in on what if any the legal risk might be for doing such a thing.
Councillor, and apologies, I've got COVID, so I'm going to be a little bit grumbly at this point, but there is a possibility of a challenge. If we want to get into that in detail, I think we'd be wise to go in private. I don't think that's necessary right now, but the answer to your question is yes. So there's a way to challenge it if it made it look like too much of a money grab.
Right, but if we could clearly indicate, as I think this report shows and some of the other evidence collected, that these properties do incur a higher service cost to the city, that that risk could be managed through that sort of rationale potentially.
Yes, you're correct, Councillor.
Okay, and and again, I really appreciate the team. Normally compliance is the direction we want to go. I think just knowing the challenge of some of the landlords that we're dealing with, I think, again, I would just go so far as to ask the mover if there's openness to removing that 1.2, I guess, of the motion in terms of setting up that offsetting grant program.
If it's, I'm looking to Councillor Salvador for should we have to? I have no problem as a mover.
Sure.
I had a similar questions about that too, right? So, but this was included, but that could be revisited some other time if to speed up things, if Councillor Salvador is okay with that.
Great, and maybe I'll just, as my last dying seconds, derelict, could we consider in that definition abandoned development properties? So sort of those holes that we have around my ward and many others as well.
So, Councillor, maybe I'll add on as well. I don't think an abandoned hole would be considered a derelict property. at least for the purposes of a non-residential definition. I think you could probably create a different type of classification for residential for that sort of thing if you wanted to, but that would have its own challenges associated with it.
Thanks very much. Hope you feel better soon.
So just from a meeting management perspective, when there's discussion around a particular part of a motion, I would suggest dividing the motion for voting purposes. But when we're at committee, dividing a motion for voting purposes means there's some division, and that speaks to requisitioning it so that all of council can vote on it. Because if on something that's sort of citywide and there's a question of a grant program versus a non-grant program, I don't know that we leave that just to committee. Particularly if when we get to voting on these things, we start losing some of our committee members, which I'm hearing we're going to. So I'll go to Councillor Salvador next, and perhaps she can speak a little bit to the point number 2 and just how important that is, as you know, as we understand it from a pragmatic perspective, that she had a hand in crafting this motion. But if there's going to be some serious conversation about that, then despite my earlier comments, we probably should send this to council to have a full council conversation about it. So I'll go to Councillor Salvador now.
Yeah. Thank you, Mr. Chair. And personally, I am comfortable removing that part. I have similar concerns around any sort of grant program, and we heard that from our speakers today. I will say this was a collaborative effort. Councillor Knack might want to comment on this as well, because I know that would be the specific part that he had included. So I don't have a problem with it. I think that there's the potential that we see kind of a gaming effect if there is a grant associated with this, just knowing what types of properties we're dealing with. So that's what I would say there. So hopefully that's helpful. But I do want to get to some questions as well from my time here. So wanted to jump back to some of the questions that were being asked by Councillor Wright around some of these properties that might be falling into arrears. And specifically, I'm trying to understand, you know, when these properties do go to tax sale auction, what is happening with them?
Councillor, we very seldom sell anything at tax sale. Part of Alberta legislation is that we must sell at market value. Council's policy is to define that by appraisal. So these properties would come forward, and any property that was on the tax sale would come forward for auction. Generally, we don't receive any bids, and then it essentially just sort of returns to accruing arrears or remaining on the tax roll until I think 15 years has elapsed, and then there's a forfeiture. Sorry.
Yeah, that's helpful. And I'm actually quite concerned about that piece. The way that I understand it, you know, if it does not sell at auction, it essentially gets stuck in this 15-year limbo. And I guess that just seems like a missed opportunity. You know, recognizing, yes, it has to be fair market value, but is there not an opportunity for the city to be, you know, acquiring these properties, maybe prepping them for sale and redevelopment? If you could comment on that, or
I can certainly comment. That would be corporate properties, real estate's purview. Sure. They tend not to step in and buy at tax sale, but my understanding is that the corporation can absolutely do that so long as we agree to pay the appraised value. Mr. Ashmore, could you speak to a little bit more of the legalities around that?
And if I could just ask one point there, yes, fair market value, but do we not get to recoup costs of those unpaid taxes?
We do. That's exactly what does happen. The taxes get essentially wiped, and then the residual gets returned to the owner of the property.
Okay. Sorry, Mr. Ashmore.
Councillor, it's actually quite a complex answer. So the minute a tax sale ends, actually a municipality can take a property as a forfeiture. But forfeiture in that sense is not the same thing as what a common sense forfeiture would mean. What that forfeiture at that sense means is a form of interim ownership where a municipality can then take a number of actions. We could market it, we could rent it, we could do a whole bunch of things. But the minute we take that step, we're taking on the risk of the property itself. So for example, if we found out after we took it as a forfeiture that there was asbestos in the property, we may actually be obligated to remedy the property. So we have to be a little bit careful of taking that step.
Right.
So it's a little bit more complicated. The 15-year date that Ms. Watt has mentioned is what I would call the ultimate date. We get it for free at that point. During the interim stages, there's a complicated stage legal process that we'd have to follow.
Right. Okay. I appreciate that. And I appreciate the complexity. I guess I can understand that there could be risk in taking these properties on. I also think there's significant risk in letting them sit in that sort of 15-year limbo. And yeah, I guess is anyone from real estate on that could comment on this as well?
Counselor, no one's here from real estate, but I am here. This hasn't been something that has been part of our real estate program. And so definitely if this is what council was looking to do, we'd have to take it back, assess the risk. I would also note that there's no funding in place, no funding mechanism currently in place for us to run a program like this.
Right. Yeah. Okay. That makes sense. And I guess given the wording of the motion around, exploring opportunities for further demolition, appropriation, or acquisition of these types of properties, that gives some direction around going back and coming with some sort of high level answer, at least to start this conversation.
Yeah, we could look at it high level as part of responding to this motion.
Perfect. Thank you.
Okay, I'm not quite sure what to do with that. So maybe I'll try to tease out some questions here. The motion reads options for definitions of derelict residential and non-residential properties for the purposes of creating tax subclasses. And as part of determining those definitions, discuss tax rate differentials for derelict property subclasses, including maximum allowable rates. So the crux of the motion is define derelict properties for the purposes of creating a subclass. If we took the discussion of an offsetting grant program out of this motion, that doesn't necessarily eliminate the concept of a grant program. The concept of a grant program is still elsewhere in the body of work, correct? Based on the reports that were received?
I mean, it certainly could be, yeah. There's lots there to explore. If council doesn't want us to look at it, or if it's taken out for a specific purpose, then we'd probably focus on other things first, prioritize it.
Right.
But it could be in there.
And if the motion goes forward more or less as written, then administration would come back with advice on what an offsetting grant program could look like, and we could decide as a council whether or not to adopt that grant program in and around the other subclass options and taxation options that we had discussed. Yes? So it doesn't hurt to have it in there. It doesn't mean we're going to have a grant program necessarily.
Correct. It would just be more information about a potential grant program.
Right. Yeah, okay. So it doesn't necessarily hurt to have it in there then from that perspective. And I understand the reticence about, giving money to people that purposely let their properties fall into dereliction simply to get a bonus. But we can explore that later. And Ms. Padbury's comment about, a grant program requires a funding source, that comment would come back in the body of work that would respond to this motion, or, further commentary around that. Is that fair to say, Ms. Padbury?
Yeah, and sorry, my comment was in the context of acquiring the properties and selling them from a real estate perspective, but it would apply here too. We would need a funding source for a grant program. We'd also need a funding source for selling taking a property from a real estate perspective.
Right, so we're talking about generate a report that talks about all those things, not necessarily go and establish a program, because a motion that said go establish a program would have to name a funding source. So I'm making sure that I'm on sign procedurally here, first of all.
That's correct. So we would come back and contemplate any funding that would be required when we returned in response to this motion.
Okay, so from that perspective then, I don't see a lot of risk in just letting the motion sit the way it's written, and we can explore what administration provides back when that's provided. Ms. Petrin, anything beyond that, or?
No, I think that makes sense.
Yeah, okay. Okay, so I will leave it there. Are there any other questions of administration or the mover on this motion? Okay, not hearing any. Trying to leave enough time for the tech. So there are, then I know Councillor Knack would like to speak to this. I'll go to Councillor Knack first. If anybody else wants to speak to it, click on, and then I'll go to Mayor Sohi to close. I'm sorry, I keep demoting you, Mayor Sohi.
Thank you, Mr. Chair, and thanks for indulging. I won't be able to stay beyond 4:30. So just a few thoughts, and I appreciate your questions, Mr. Chair. You know, I've gone back and forth on the idea of a grant thing, but appreciate that it's probably better to get the information than to not have it when the time comes. Because I think while those who are deliberately doing it, I have a lot of concerns about getting money for them. If there are legitimately derelict properties, maybe somebody who's older that has fallen into an inability to maintain their property as well as they would have liked, maybe there's a place for something like that. So I'm at least willing to consider that. But more broadly, why I wanted to speak to this has been something that actually first came up. I remember at the Glenwood Community League annual general meeting yesterday, and their president, Jamie Post, was one of the first people who I remember bringing this up in 2010. And it wasn't until 2018 that we were allowed the opportunity to even explore this. And I think based off what we heard through our speakers earlier today, and really the ongoing challenges that we have had with derelict properties, it is time to use this tool. While I think the other motion will be really important as well, and I don't want to take anything away from that. I think that's fantastic, and I want to thank Councilor for all of the important work to doing that work. I think we also need to use this financial tool. I think people need to be financially penalized for running down neighborhoods, and so I think it's time. We should consider using this. We've looked at many different options over the years. And this is just one of those. I've been around for a long time now, and this is one of the ones I think it is important as something that would help maybe spark some redevelopment or some proper maintenance of those sites. If you're starting to get hit financially, it might change things in a more meaningful way. And we have to remember there is a cost to all of the work that our city staff are doing, trying to bring these properties up to a certain standard. It costs a lot of money to have these teams out over and over again, constantly trying to maintain things, trying to respond to the calls from residents who are dealing with this over and over and over again. And again, I just think we should make sure that we are not the ones incurring that cost of constantly having to manage these properties. So I think we need to do this. Again, I realize that approving this motion doesn't mean we will absolutely do it, but in the interest of full disclosure, I am very much ready to support that when it comes back. I've been wanting to see that particular change for a couple of years now, and think we need to do that. Again, noting with the caution of the grant piece, I'm willing to at least see what we might do with that going forward. And since I'm just speaking to this motion, I'll just leave it there. Other than to say, I think the other motion is great, and hopefully we look at the teams working outside of normal working hours as well, maybe evenings and weekends. I know that I'm not speaking to that motion. Sorry, Mr. Chair, I was cheating a little bit. Thank you.
Oh, that's fine. I don't see anybody else on the board speaking to it, so I'll go to Mayor Sohi.
Yeah, I will be very quick. Want to thank Councillor Salvador for taking a leadership on all of these motions and the work she done with community. I would have to leave by 4:30, so I'll kind of try to wrap my comments related to both motions. Very brief. Problem properties pose a serious risk to community well-being and community safety, and they pose a serious risk to our most vulnerable Edmontonians. And we saw that when 4 houseless Edmontonians died in a fire in last fall. So it's something that we need to take very seriously, and our administration does, and I appreciate that. We should have a zero tolerance for problem properties, and we should have a zero tolerance for slum landlords. And they should know that that city will come after them with all means available that are available to the city, and if they don't clean up their properties. So I'm very happy to support all these motions.
Thank you, Mayor Sohi. Please vote.
Yep. Just waiting for Councillor Wright's vote.
Sorry, it's resuming session, so I'm a yes.
Thank you. We have 5 votes.
Please display the vote. And that is carried 5-0. Thank you, everyone. So we'll move now to Mayor Sohi's first motion. Now we're bouncing around a little bit. Do you want a motion to bring that forward, Madam Clerk, or are we okay?
I think we're okay as it's within the same item.
Okay, thank you. I'll now go to Councillor Stevenson to ask her questions about this motion.
Yes, thank you. I was hoping to get a bit more clarity around the housing redevelopment grant, and it actually ties in very well, I think, to the conversation we were just having around tax forfeitures and different real estate approaches we might be able to take. So just wondering if perhaps Ms. Kajener from Housing could speak to the possibility of, so the report right now suggests that the housing redevelopment grant program will be ended and will not continue. Wondering if there's some opportunity to maybe revisit and revise that program to maximize the benefits.
Sure. Thanks for the question, Councillor Stevenson, and I apologize for not being here earlier after the break. So the program was successfully implemented. So 3 different properties received $1.5 million, and which will be used to fund 16 new units of affordable housing. So the program was successful in terms of stimulating redevelopment, but there were a number of challenges related to the way that the program was designed that undermined the achievement of the broader goal of redeveloping the most problematic properties, and that being properties that were currently occupied and drew the most complaints from neighbors. And as well, providers indicated a number of challenges with the rules to mostly that inhibited them from being nimble in terms of taking advantage of acquisition opportunities when properties went onto market, and the proportion of the funding that was allotted was insufficient in their mind to be able to support acquisition at scale. So I think there is some opportunities around affordable housing, no question, with when it comes to problem properties. There's sort of 3 affordable housing needs. One is the immediate needs of the people who are being evicted if a property is being forced to close. The second is a broader pool of modest housing to serve the needs of people who have no other choice but to live in a property that would be considered a problem property. And then the third is the possibility of using affordable housing grants to stimulate development. And I think we could offer some insight into learnings from this grant program to support the achievement of any one of those sort of 3 broader goals around affordable housing as it relates to problem properties if council so desires.
Great, thank you. We'll follow up with a potential motion if one of my colleagues are willing to move that, but thank you very much.
Thank you. Any further questions or just to speak, Councillor Salvador? Just to speak? Okay, I'll go to Councillor Jan's questions.
Can I move the motion on behalf of Councillor Stevenson?
Well, let's finish this one first.
Got it.
Yeah. Councillor Knack then to speak. He may have left us. Councillor Salvador.
Great, thank you so much. So just want to start by thanking administration for the work that went into this report. Also really want to thank the community members who have been advocating for City Council to take action on this very serious issue for a very long time. That being said, I wish that you didn't have to. I wish that your organizing efforts and time and emotional labor could be put towards organizing block parties and fun community events. But instead, in many ways, you have been brought together because of this crisis and ongoing chronic trauma in our neighborhoods. This issue absolutely has reached a boiling point, and I want you to know that I see you and that I'm making every effort to address this alongside my council colleagues. Just reflecting on the months leading up to and following the election, I remember, news report after news report was released about the growing number of fires in vacant and derelict properties. And of course, the media wasn't able to cover all of those fires because they were happening at such an alarming rate. And beyond that, the issues surrounding problem properties have been really growing for years. And I firmly believe that urgent action and investment is needed now. We heard about the social consequences of this degradation of community safety. They've been dramatic. People are also picking up and leaving community because of the ongoing terror, really, resulting from living near these types of properties and near an ongoing threat associated with them. We simply can't let this continue. We have to be swift and decisive in our approach, and I do expect to see bold action. And I believe that this motion does provide the resources to do that. While the social costs absolutely should be top of mind, this is about more than the social consequences alone. There are significant, direct, attributable economic costs associated with problem properties. And as we learned through the case studies presented in today's report, this is a problem that creates millions of dollars in costs to our agencies, Edmontonians, and significant calls for service. Across just the 31 properties that were included in the report, we're looking at over $1 million in costs. So the Residential Inspection Safety Compliance Team identified 486 properties, ECDC another 250 properties. So we're looking at 10 or even 20 times as many properties as in our current sample in the report. So I can't stress enough the real financial costs borne by the city through inaction. Now, the motions put forward today, I think, represent a relatively small investment, but I think it's very plain that there's an incredibly compelling case here that the Community Property Safety Team, alongside dedicated resources for a centralized coordination hub, will generate a significant return for all of us. And if left unaddressed, the direct cost alone will continue to be far greater than what's contemplated in the motion before us. So again, I'll just reiterate that this work cannot wait. Even if we start today, it's going to take time to actually get it rolling. And in that time, there will be costs to Edmontonians, to community members living near these properties, to vulnerable and marginalized Edmontonians who are being exploited and harmed, and to our frontline workers. And that didn't quite come up today, but emergency responders who are placed at significant risk when responding to calls at these sites. Now, just finally, we do have the tools and authority to take stronger action. We're supported by legislation to act, and the social and economic case is truly compelling. I'm encouraged by the approach presented before us today and firmly believe that this is a problem that cannot be dealt with off the side of people's desks. We need to properly resource this work to see the outcomes we desire, and I think the community deserves and expects that. So yeah, I really look forward to seeing this motion move forward. I would ask my colleagues to support it. I think this is incredibly important work that deserves attention. Thank you so much, and I again really appreciate the time that everyone took to come out today and for all the answers to my ongoing questions. Thanks, everyone.
Thank you. Councillor Stevenson to speak.
Very briefly, certainly echo the comments of my colleague, Councillor Salvador. I'm very grateful for her leading the charge on this. I think one of the most important pieces of this work is not only directly addressing the problem properties and creating a safer community, but removing that burden from our communities. As Councillor Salvador said, that community energy should be going towards so many other community building projects, and I really look forward to the city having the resources to step into that more proactive space to keep our community safe and also remove that burden from our residents. So thank you so much to everyone for the ongoing work. It's really exciting and so pleased to see this moving forward.
Thank you. Normally I'd go to Mayor Sohi to close, but he's had to depart. So I think that concludes speaking to it. Please vote.
We have all 4 votes.
Please display the vote. That is carried. I believe Councillor Jans has another subsequent, so I'll go to him.
Thank you. On behalf of Councillor Stevenson, does the clerk have a copy?
It's just on its way.
Thank you. Councillor Stevenson requests that admin provide a proposed update to the Housing Redevelopment Grant Program to apply lessons learned and opportunities to align with efforts around problem properties, returning Q3.
And we just updated the wording just a slight bit, so just looking to confirm that that is all right.
I look to my proposer and I see a thumbs up. Yes, correct.
Any further comments to introduce it?
I would not like to introduce it.
Okay, any questions to administration or to the mover? Sorry that we're stuck with process. If there's no questions, then we'll move to speaking to the motion, and I'll go to Councillor Stevenson.
Thank you, and thank you, Councillor Jans, for putting this forward. What excites me most about the work that we're doing is that we're looking to deploy all the tools that we have in our toolbox. So great to see Edmonton Fire Rescue Services, all of our bylaws. But I do think that our grant program to support the redevelopment of these properties is another really important tool. And I just don't want to see that removed off the table completely. Certainly, there were lessons learned through the first iteration of that. But again, I think that those issues can be addressed and revisited rather than scrapped altogether. So that's the intent of this motion, just to be able to understand if we can continue to use that tool and employ all the different ways that we have to help address problem properties in our community, particularly ensuring that the supply of safe, affordable housing is available for everyone in our communities. Thank you.
Thank you. Closing comments, Councillor Jans? No? Please vote.
We have 4 votes.
Please display the vote. That is carried. I don't think there's any other motions on item 6.1. Very good. We'll move then to item 6.2, and I'll go to Councillor Wright to start. I believe she has a motion to make, so I'll ask her to put that motion on the floor, and then we'll take questions to either the mover or to administration. Councillor Wright?
Yes. Oh, do I have to request to speak? There we go. Okay, so they are on the board then. I will just read them out. That Community and Public Services Committee recommend to City Council that 1, administration as part of the upcoming update of the City of Edmonton Affordable Housing Strategy, incorporate the housing needs of women and other persons fleeing domestic violence and identify key actions. And 2, that the mayor, on behalf of City Council, write a letter to the Ministry of Community and Social Services highlighting the need for additional financial resources to address the shelter needs of women and other persons fleeing domestic violence in Edmonton, and requesting that additional financial measures be considered. And 3, that administration, as part of its ongoing advocacy efforts, incorporate an advocacy strategy to raise the profile and awareness of women and other persons fleeing domestic violence and the need for immediate supports for them and their families.
Thank you. Would you care to introduce it, Councillor Wright?
Yes, as I mentioned earlier today, my concern with during our budget time was the what was identified by Chief McPhee, the increase in domestic violence calls that they were being brought out to. And I'm just hoping that by providing some additional resources as part of the affordable housing strategy and advocacy to other levels of government, that we can provide some preventative measures for women and others fleeing domestic violence.
Thank you. Any questions for the mover or for administration? I have a question for the mover. Councillor Tang, go ahead.
Okay. Yeah, thank you for this. I guess to administration, there's there's certainly a lot of there's mentions here around, an intergovernmental piece. For some of our existing tables and initiatives, how much do we interact with the government of Alberta?
Ms. Schmidt, did you want to speak to that?
Absolutely. Thank you for that question. We meet on a very regular basis with the Community and Social Service Ministry, who leads in the family violence area. We are also partners with the Status of Women Ministry on our gender-based violence and sexual assault initiative. So we maintain close contact with the provincial government.
That's great. And just cognizant of the linkage with between the issues of domestic violence, family violence, and when it comes to community well-being and safety, similar to a previous question I asked on the problem property, for the work that's currently being done on that strategy, on the community well-being and safety strategy, is domestic violence, women's shelter, and support and family violence part of that discussion with funding implications?
Currently, Councillor Tang, so currently some of the initiatives around the prevention of violence are absolutely part of the community safety well-being framework work that is getting put together. With respect to a gender-based violence funding implications specifically, I'll just defer that to Ms. Smith.
I am unable to speak to the task force piece, as I am not directly related to that. However, again, with the gender-based violence and sexual assault initiative, we do have a strategy, and with Edmonton Safe Cities, which is a project of that initiative, we have 21 recommendations that we are currently working across administration to implement.
Right. I'm not talking about the task force. I'm talking about the May 16th report coming back on the motions around community well-being and safety funding to offset the pressure on policing. On policing. But that's helpful. So thank you. Actually, I'll leave it there. Back to you, Mr. Chair.
Thank you, Councillor Tang. So to the mover then, in our offline conversations, there was some mention of funding. So is there part of this motion that you wanted to make that had a funding component?
Yes, there is, but I thought I would do it separately from the sort of the advocacy and.
Oh, so you have another motion coming today?
Yes.
Okay, I see. Okay, thank you then. I have no other questions on this one. Any other questions? Anyone wishing to speak to it? Councillor Wright to close. Nothing further?
Nothing further, just looking for committee support. Thank you.
Very good. Please vote.
We have 4 votes.
Please display the vote. That is carried. All right, then back to Councillor Wright for your subsequent motion then.
All right, I'm just waiting for the clerk to put that up.
It should be just 1 minute.
Just a second, Councillor Wright.
Okay.
Thank you. Would you like to read that in, Councillor Wright?
Yes, please. That Community and Public Services Committee recommend to City Council that the Social Development Branch Community Services 2022 operating budget be increased by $880,000 on a one-time basis from the Edmonton Police Services funding held within financial strategies to fund the Edmonton's Women's Shelters request as outlined in report CS 00947.
Thank you. Would you care to introduce it?
Yes, thank you. Just recognizing that although we can do some advocacy and other planning under affordable housing, I do think that there's an immediate need for the women's shelters to receive the funding and provide the support that they identified this morning in their presentations to us. I realize it is a provincial responsibility on the whole, but these are our Edmonton community members, and I think that they need our support, at least in the short term until we can get some work done with the province.
Great, thank you. Councillor Tang.
Great. So this is the question I was referring to earlier. When that motion comes back on May 16th, I'm very keen to know whether or not we see domestic violence as part of this portfolio that can draw a direct line in terms of outcomes achieved with the policing funding. So please do respond. Thank you.
No problem, Councillor Tang, and apologies. I had an opportunity to double check, and currently there is not a gender-based violence resource ask being incorporated into that report that's advancing back in May. However, we do certainly see the work of ensuring Edmonton's a safe city for all, including women being free from violence, as part of that framework. In that currently developing.
Okay, I think you cut out there for the last few seconds for me, but I think I caught most of that. I guess my point is simply whatever funding decision we do make, I think there needs to be a direct tie back to, why are we setting aside this funding? Domestic violence came up during, the commission report. It's been highlighted as a key, cost to the police. So I feel like there's like a very clear line. I just want that to be really explicit. I am also curious, this comes up during the conversation around shelters and housing, but is there a risk of further downloading from the province if we start to starting funding more in this space? Is there a risk of that, or is it just simply, we've been doing a lot of this preventative work in the past? I'm thinking specifically of the nursing resource, and hence my question earlier to the speakers around why is this not even AHS supported? I guess to Ms. Kajener.
Sure. And so obviously, the City of Edmonton works with our partners, including the Government of Alberta, to support a number of initiatives. And, obviously we do make investments in areas that might not be traditionally considered the purview of the municipality because council prioritizes those areas for investment. We do try to focus on areas, though, where we're not duplicative of existing provincial investments. So, in the past, the city really hasn't funded emergency shelter outside of the pandemic or extreme weather. And that would, be similar to women's shelters as well. But we're obviously having a broader conversation around that where the city has more recently become involved in that sort of thing. And so ultimately it's at council's discretion and decision. But typically we have funded other healthcare expenses in the past, although to be sure, our preference would be that the health system support access to those resources.
Of course, yeah, thank you. And then in the report it says that there will be a funding agreement. I'm just curious, like with who though? Is that with the council, the Alberta Council, or is it with individual providers?
Councillor Tang, I had that discussion with the council and with the providers, and we weren't sure what to do until the funding was decided upon. So I will be working with them to decide which is the best way to do that and how they would collect their data to provide the final report.
Yeah, no, that's good. Because I also noticed that out of this total sum, there's nothing for administrative cost in terms of processing, these grants and stuff. So I think that's important that, the money definitely gets in the hands of those who are directly providing the service. Yeah, okay. So I understand that there'll be more conversations coming then. So I appreciate the mover for putting this on the table. Like I mentioned, we get these requests periodically. Sorry, I'm just using my last minute just to speak to this. And I think the situation is quite dire. And I feel like the women's shelter, the conversations don't really come up enough, and they're so hidden, like some of the speakers have alluded to. So I'm glad that we're providing support where we can, and I do want to acknowledge and I want to thank administration as well for such a strong network of partnership to support the women in need in our community. So thank you, and happy to support this.
Thank you. Any other questions? Anyone else wishing to speak to it? Councillor Wright, closing comments.
Thank you again. I know this is an unusual request. It's not our normal area of responsibility, but I also reflect back on just last week when we looked at the approval for, I think it was 1.8 million for the day shelters as well. And our city manager had indicated that it's not something maybe we should hold back from, that there's people in need, and so we should look at funding that. So that's sort of part of my rationale, is that these are women in need, and we do need to look after them. They're our fellow Edmontonians.
Great. Thank you very much. Please vote.
We have 4 votes.
Please display the vote. That is carried. Anything else on 6.2? Very good. That takes us to 6.3. Now, we're kind of limited on time. This is an information, oh, pardon me, it is not. This is, the recommendation in the report is that committee recommend to council that this bylaw be given 3 readings. Are there any questions for clarity on that recommendation? And if there's any lengthy debate or dispute on that, we're probably at a point of requisitioning to council.
Do you need a mover?
I would need a mover, yeah. To move,
so moved.
To move the recommendation. Thank you, Councillor.
No questions.
Chance. No questions. Anyone with questions on that recommendation? Just want to suggest that if there's questions, ask them now and not next week. Okay, seeing none, please vote on the recommendation in, or Councillor Jans's motion to move the recommendation in the report, and that is that Community and Public Services Committee recommend to City Council that bylaw 19984 be given the appropriate readings. Please vote.
We have 4 votes.
Please display the vote. That is carried. Are there any notices of motion or motions without customary notice today? Hearing none, we are adjourned. Have a great night, everybody.